Ladies and gentlemen, this is the moment that we're all waiting for. This is our final conference, and it's a big pleasure for me to be a host of this great event. My name is Paweł Typiak, and I'm a journalist from Polish Radio Free. I would like to welcome everyone from all around the world, and now it's time for welcome message. Please welcome Professor Wiesław Gruszecki, Vice Rector for Science and International Cooperation of UMCS. Big applause, please.
Ladies and gentlemen, dear friends, on behalf of authorities of Maria Curie-Skłodowska University, I welcome you cordially on this final conference of REINITIALISE project. And you know better than me that the project is focused on development of strategies, of attitudes to protect fundamental rights, but also with application of digital technologies. And all these words usually come from different worlds. So the project is more than international, interdisciplinary. It's multidisciplinary and even more. And also I would like to stress that this is that we are happy to see all our partners from Catholic University Leuven, from University di Macerata, and from Eurocentro. And I experienced from previous some meeting activities that all activities were very friendly atmosphere, attitude, and I hope that this partnership will last for longer time, that this final conference is not the end of this collaboration, but it's a good point of entry to future interaction and different other projects. And we are a bit late, so I will not speak any longer, but we will see you around and we will have time to discuss. Thank you.
Thank you very much. I'd like to invite Deputy Director of Institute of Social Communication Media Science, Dr. Wojciech Maguś. Please, big applause.
Good morning, ladies and gentlemen. I think that Rector Gruszecki said everything, but on behalf of Professor Iwona Hoffman, Director of our institute, I want to welcome everybody, everyone in this closing conference of this project. I think that the project develop many things about our health. I think that you have many connections and take many activities. Today it's time to take a conclusion. The conference program is very interesting, and I wish you all a good time. Thanks.
Thank you very much. And now we will connect to Ilona Biernacka-Ligienza, Project Coordinator. I hope we have an online audio connection. Hello, Professor Ilona Biernacka-Ligienza.
Hello, good morning. Can you hear me? I hope you can hear me well. Good morning, everyone. I would like to welcome all our participants, especially all our partners who came to the conference. First of all, please take my apologies for not being personally, but because of my serious health issues, I'm not able to participate in person in the conference. So I'm sorry for that, but my heart and mind is with you at this moment. That's why I would like to say a few words as the summary and opening for today's conference. I would like to thank you everyone who took part in the project during all those 3 years. Especially, I would like to thank our partners for great input and involvement into this wonderful research and practice, because REINITIALISE is, of course, a crucial point in terms of researching digital challenges in terms of the health issues, especially in terms of seniors who are dealing with new technologies and who are facing all those changes, because that was the major core topic for researching and analyzing during those last 3 years. But also, I would like to thank you all practitioners who supported us during the project lifetime. And without the involvement of our stakeholders, this project wouldn't be so efficient as it is. All the ideas which were created during the Venture Lab session are the ideas which in the future may support the health sector, and also may help elderly people and people who are dealing with health issues in practice. This is the biggest value of the project. The point where the research meets with practice, and when the practice is also taken into consideration as help for people who are looking for a kind of support. And our seniors, our target audience, they are our major target audience, and I'm sure they will benefit from what has been elaborated during our project. So I would like to thank you, all those people who put a lot of effort on both sides of the project. First, on the research which was done. Second, practice which was carried out on the basis of the research. Today's meeting is the time when we will have some kind of discussion, debate about what has already been done, how the health sector has changed through the technologies due to those challenges which pandemics and after pandemics time brought into our life. Moreover, during the panel discussion, I hope we will look for the future possibilities and solutions which are still in front of us, especially in terms of AI technologies, which is becoming more and more powerful tool for managing the health sector. So I'm absolutely sure that today's meeting, both partly being a summary of what has been done and what our project has brought into research and practice, together with this discussion during the panel session, will open the new door for the future debates, for future practical solution which may support the health sector, mostly in terms of everyday usage of tools, and which may be also supportive for us as for researchers, because it will open us new paths for research and for collaboration. I'm sure that today's meeting is not only the closing meeting for the conference, for the project, but it's an opening meeting for new challenges which are still in front of us. And I'm sure that this strong team of researchers and practitioners who is gathering today in the center will focus on those new challenges and will follow new projects with great involvement, and the fruits of those future cooperation paths will be seen as research projects, as applications which may be supportive for the patients and everyday users. I would like to thank you also everyone who supported us from the administrative side. I would like to thank you, our rectors of our cooperative universities. That was a huge challenge for everyone, especially as we started the project just in between the time between after COVID, and we were not certain at the beginning how the future will look like. But fortunately, we managed to carry on with the project till the end. So I would like to thank you, everyone who supported us during all our activities. And also, I would like to thank you all today's guest speakers, keynotes, who are kindly open to start a discussion for new topics of the health sector issues. So I would like to thank you, all participants, all keynote speakers, and everyone who was supportive towards our project. I wish you all today great discussion. I hope that by the end of the day, we will reach the conclusion that the project and the ideas which were elaborated during the lifetime of the project were worth to do it, and we will find the new opportunity for ourselves, and we will start new interesting collaboration for the future projects. Thank you so much, everyone, for joining the conference, and thank you for being with us today. I'm sorry one more time for not being present, but my heart and mind is with you. Thank you so much. Have a nice day, have a nice discussion, and I wish everyone great experience and great discussions during the entire day of conference. Thank you so much.
Thank you very much. That was Professor Ilona Biernacka-Ligienza, Project Coordinator. And ladies and gentlemen, this is the moment when we will hear a keynote speech. First, I would like to invite Professor Robert Rajdak, Medical University of Lublin. Big applause, please.
Ladies and gentlemen, it's an honor to be here. I would like to, being an ophthalmologist and medical doctor and physician, I would like to show you some practical example how to, let's say, implement IT technologies, new ideas into the system. May I have a first slide, please? So here in Lublin, we work since many years on digital medicine, telemedicine, implemented into very fast pre-screening of patients. This is example how to use this methodology in diabetic patients to screen for early symptoms of diabetic retinopathy. We work together with a group from US, from Rutgers Institute, Rutgers University, Professor Marco Zarbin and Bernard Schirt. And we know that diabetic retinopathy is a common cause of blindness. And it is really very let's say, irreversible if you don't diagnose it early and if you don't implement early treatment. So, of course, we know that especially diabetic macular edema and proliferative diabetic retinopathy are forms we would like to avoid, and that is why we are using nowadays new technology. New technology normally is used in the big center in the office of ophthalmologist, but we, instead of this, we decided to send such cameras to small villages on van or let's say to transport them, and who is going to these small villages or towns is not ophthalmologist, but a technician. The ophthalmologist is waiting for results in a big center. And of course, we are using artificial intelligence, or let's say, ophthalmologist also can check these fundus photographs by himself, just indicating who of these patients should be sent from this small village to the center for the treatment. You can see here, these are examples. This is the, let's say, very early stage on the left. So normally, artificial intelligence or the physician sends the message, follow up in 6 months. If you see so many red dots or yellow yellow areas, you normally send the patient for anti-VEGF injections. Here we can see abnormal vessels. So this is the sign and indication for pan-photocoagulation, laser photocoagulation. And if on the right photo you see scarification, you see fibrosis, this is the main indication to perform vitrectomy. So a very complicated surgery. And the system works like this. It is really nowadays easy to use non-invasive techniques. So this is comparison of histological examination. You see microaneurysm and enlargement of avascular zone. Of course, these are, let's say, medical terms, but I would like to show you how nowadays we can use non-invasive technologies. On the right, we have fluorescein angiography. So you must inject the dye intravenously and then take photographs. This is very complicated, but you can, and you detect, of course, avascular non-perfusion areas. But if you use OCTA, on the right, so this is totally non-invasive technology. It takes 30 seconds to take such a photo. You get much more information than using classical technologies like fluorescein angiography. So that is why we are nowadays able to really detect symptoms of disease. On the right photo, you see diabetic macular edema, and the image is taken within 30 seconds, just using non-invasive imaging technology, and upon this result, we can tell, okay, this patient should be treated immediately. So telemedicine is really new technology. Image is taken rapidly in combination with artificial intelligence software, like we can have on the market. There is a program iNook, but in Lublin we are now working on our own artificial intelligence algorithms to be used soon in this strategy. And of course, we know that this is so sensitive that you can screen really big groups of patients. You are receiving such results, so fundus photograph. You can also have OCT images, both OCTA and OCTB scans, so transverse or en face. photographs detecting early symptoms of the disease. Also, you can use it not only in diabetic retinopathy, but also glaucoma, also cataract, so different stages. Also, I can remind you that on the fundus of the eye, you can see also signs of hypertension. Also, you can assess risk of stroke or heart attack. So really a variety of possibilities. And how it looks in US. This is first, I'm showing you some, let's say, expertise of my colleagues in New Jersey. So they take photographs standing. A patient is standing just not to lose time. Then artificial intelligence checks the photograph. If there are no findings, the screening is recommended next year. If there are any findings, then they take OCTA, and even there is a special robot. You can speak with the eye doctor, retinologist using such a system. Then really the diagnosis is complete. So this is like I am making jokes like McDonald's, ophthalmological McDonald's. You can screen really a lot of patients, like 120 subjects a day, done by technician and nurse, and the only results are sent or checked by physician or just after artificial intelligence. Now I would like to show how fast is this examination. You can see that, let's say, we are using non-mydriatic camera. So we don't need to dilate pupil before the examination. This is really a very fast process, and all photographs are taken, are stored and analyzed by computer system. So this is a fundus photograph. So in 3 minutes, 16 eyes. And now we can see OCTA, OCTB. I remind that if there are any symptoms on the fundus photograph, then only selected patients are examined by OCTA and OCTB system. So again, you can see it is a little bit longer, but anyhow, very fast. And I remind you, normally every of these patients should first visit a family doctor. Then he should have appointment in office of ophthalmologist in the, let's say, local small, let's say, village or town. Then he should be sent to, let's say, clinic, department. So normally it takes half a year, you know, to have really the diagnosis. And in this system, we have 15 eyes in 5 minutes. This is US. And again, just to sum up how it works, also here you see the van, they transport equipment and personnel. But in Lublin, we started our own project, which is, in my opinion, but also in opinion of my colleagues, better, is implemented to the system of health system, general practitioner system, and normally we have around 2-3 million patients with diabetes mellitus, and 30% of them have diabetic retinopathy, and 30% of them are really in danger of blindness. So I am supported by colleagues from US. I am the principal investigator, and this is iBus, Oko Bus in Polish, and how it works. We have the equipment on the van, going to small villages. And the technician and the nurse are taking photographs of diabetic patients. Diabetic patients are invited by general practitioner to be examined, and all these photographs are sent to Lublin, to our department. We check early symptoms. If we find early symptoms, then we indicate, okay, Mr. A, B, C should be sent to Lublin for immediate treatment. So this is small Polish village. In Lublin region, we have many such villages, and patients have difficulties with access to ophthalmologists. So up to now, we started in March, we examined around 6,000 diabetic patients, and there is a plan to really enlarge this project, not only in Lublin region, but also whole country. So thank you very much for your attention.
Thank you very much. That was Professor Robert Rejdak, Medical University of Lublin. And now it's time for Aleksandra Wesołowska, Program Officer, EU Policies. A big applause, please.
Ladies and gentlemen, esteemed guests, conference organizers, it's a pleasure for me and an honor to address you today in the opening session of this conference, organized by the REINITIALISE project funded by the European Commission under the Horizon 2020 Twinning Program. So let me maybe briefly introduce myself. I work in the European Commission DG Connect. This is Directorate General for Communications, Networks and Technologies. I work in Luxembourg, and we work on digital policies. We support research, innovation, and deployment projects on technologies in the health sector. Let me start by stating the obvious. Every day and everywhere, digital technologies, and in particular technologies based on artificial intelligence, are gaining popularity. Artificial intelligence is an enabler in many sectors and many industries, from scientific research, education, logistics, to media, politics, everywhere. And also in healthcare, the advancements in artificial intelligence, combined with the abundance of digital data, have created a great potential to transform healthcare. Artificial intelligence can help develop new healthcare products and services. It can help provide faster diagnosis and better treatment. Ultimately, it can increase the efficiency of the health sector, as was exemplified by the previous speaker. On the research and development side, there have been very fast-paced developments in recent years and months on artificial intelligence. For example, the recent integration of large language models introduces a significant new dimension to the abilities, to the capabilities of artificial intelligence. These new developments raise both new potentials, but also new challenges. Since the European Union published its first comprehensive strategy on artificial intelligence in 2018, technology has no doubt leaped forward immensely. But what has not changed is the fundamental principle of our approach, that is the need to strike the right balance between reaping the benefits of artificial intelligence while at the same time protecting the values which are most dear to us, that is human rights, pluralism, inclusion, and protection of privacy. In her State of the Union address in September earlier this year, President Ursula von der Leyen said that our #1 priority is to ensure that artificial intelligence develops in a human-centric, transparent, and responsible way. There is a number of challenges concerning the development, deployment, and use of artificial intelligence in healthcare. These include ethics, clinicians' liability, data protection, performance of artificial intelligence systems in diverse clinical settings, but also healthcare professionals' skills, trust, acceptability of the technology, and explainability of the underlying models. When we talk about developing and deploying AI solutions in health, we have to be sure that the AI prediction is both reliable and transparent. We have to be sure that the AI is trustworthy so that clinicians, patients, and researchers can confidently rely on it. And we have to ensure the compliance with the GDPR rules in any phase of the development and use of the AI solutions. The emergence of generative AI has important ethical implications. Beyond the dangers of using such technologies related to misinformation, there is also the question of human dignity and autonomy. In the realm of healthcare, citizens and patients are increasingly likely to find themselves interacting with tools driven by artificial intelligence, whether it will be for arranging appointments, tracking their well-being, or gaining insights into their illness and how to manage it. As autonomous health coaching programs evolve to closely mimic human interaction, there is a risk of diminishing human oversight over these technologies. And there is a risk of potentially eroding the traditional human-to-human, person-to-person connection that characterizes the field of medicine. To ensure patient autonomy, patients need to understand the limits of AI-generated recommendations. Today, I would like to talk to you about three things. Firstly, about the developing regulatory framework on artificial intelligence in Europe. Secondly, the support that the Commission is providing for research, innovation, and deployment of trustworthy AI, in particular in the healthcare sector, and how, through these actions, we are aiming to increase trust and adoption of AI technologies in Europe. Let me start by saying what the European Commission is doing in terms of policy and regulatory framework. The European Union can be considered a front-runner with regard to establishing a framework on ethical use for artificial intelligence, regulating the AI. In 2018, the Commission adopted a communication to promote the development of artificial intelligence in Europe. In 2019, it published a coordinated plan on artificial intelligence endorsed by the Council of European Union to coordinate the EU member states' national AI strategies. In the same year, 2019, the high-level expert group on artificial intelligence set up by the European Commission published the ethics guidelines for trustworthy artificial intelligence. These guidelines put forward a set of 7 key requirements that AI systems should meet in order to be considered trustworthy. The guidelines also contain an assessment list to help assess whether the AI system that is being developed, deployed, procured, or used adheres to the 7 requirements of trustworthy AI. And these 7 most important requirements concern human agency and oversight. There must always be human in the loop. Technical robustness and safety, privacy and data governance, transparency, diversity, non-discrimination and fairness, societal and environmental well-being, and accountability. Since then, since 2019, the European Commission has taken several horizontal initiatives that seek to ensure the trustworthiness of AI. In April 2021, the Commission adopted a proposal for regulation laying down harmonized rules on AI. This is the AI Act, and this AI Act is currently under discussion. And it aims to develop an ecosystem of trust by proposing a legal framework for trustworthy AI. The AI Act will guarantee the safety and fundamental rights of people and businesses while strengthening AI uptake, investment, and innovation across the EU. It will provide risk-based, legally binding rules for AI systems that are placed on the market or put into service in the European Union. The AI Act defines 4 risk categories, and for high-risk cases, such as in health, AI systems should be transparent, traceable, and guarantee human oversight. Such systems will be subject to strict obligation and a conformity assessment before they can be put on the market. Authorities should also be able to test and certify the data used by the algorithms. Through the AI Act, the Commission is setting out to create an innovation-friendly, risk-based and future-proof approach to regulating AI. And this is the future-proof that I want to stress. The measures to ensure transparency, accountability, risk management, and public oversight introduced by the AI Act will also help us deal with more uncertain risks that we will encounter as the technology develops. The discussions are now ongoing, and the Commission expects and hopes that the agreement on this law can be reached before the end of the year. The European Commission promotes also international discussions on AI governance with a view to achieving trustworthy AI. The legally binding rules that I just mentioned, they are complemented at a global level by the G7 guiding principles and the voluntary code of conduct, which have been agreed by G7 leaders on the 30th of October. The 11 guiding principles adopted by the leaders of the 7 countries and the EU provide recommendations for organizations developing, deploying, and using advanced AI systems, such as foundation models and generative AI, to promote safety and trustworthiness of the technology. And these guiding principles reflect EU values to promote trustworthy AI. President von der Leyen called on AI developers to sign and implement this voluntary code of conduct as soon as possible. Another question that I thought would be interesting to discuss today is how to win and maintain the trust of citizens to use new technologies. It is clear that societal acceptance of emerging technologies requires legal certainty and trust. To reap the economic and societal benefits of artificial intelligence and promote the transition to digital economy, it is necessary to adapt legal frameworks, for example, the civil liability rules. These rules need to be adapted to take into account characteristics of artificial intelligence systems. So in September 2022, last year, the Commission adopted a proposal for the revision of the Product Liability Directive. The revised directive seeks to ensure that liability rules reflect the nature and the risks of products in the digital age and circular economy. The proposal for the revised directive seeks to ease the burden of proof in complex cases and to ensure legal certainty, and that there is always a business based in the EU that can be held liable for defective products bought directly from manufacturers outside the EU. Also, the European Commission made a proposal for the Artificial Intelligence Liability Directive at the same time, September 2022, that deals with claims for harm caused by AI systems or the use of AI, adapting non-contractual civil liability rules to artificial intelligence. The AI Liability Directive aims to ensure that victims of damage caused by AI obtain equivalent protection to victims of damage caused by either other technologies or by products in general. So I mentioned these 3 legislative acts: the AI Act, the Product Liability Directive, and the AI Liability Directive. They form a 3-part regulatory system for preventing harm and for regulating artificial intelligence in the European Union. So we hope that this horizontal regulatory framework will contribute to societal and consumer trust and thereby promote the rollout of artificial intelligence. So this is the horizontal framework, but this is obviously not the only thing that the Commission is doing. We also provide funding for research, innovation, and deployment projects relevant for the development of trustworthy artificial intelligence. Only last week, a new set of calls under the Horizon Europe program has been launched to drive research in data and computing technologies, catalyzing innovation in artificial intelligence. And one of the topics under that call focuses on innovation in AI-powered data operations, resulting in bias-free AI systems and services. A number of actions on development of new tools, technologies, and digital solutions specifically for health are also supported from the Horizon Europe program. A number of projects started earlier this year on trustworthy artificial intelligence tools to predict the risk of chronic non-communicable diseases and or their progression, and also another set of projects on computational models for new patient stratification strategies. Another set of projects, which started in 2022, focuses on clinical validation of artificial intelligence solutions for treatment and care, and another set on data-driven decision support tools for better healthcare delivery and policy making with a focus on cancer. And early next year, projects on the development and harmonization of methodologies for assessing digital health technologies in Europe will start, subject to successful conclusions of grant agreement preparations. So these are all, if you want, clusters or sets of projects. Every time there is maybe 5 to 8 projects which will run for 3, 4, 5 years. I'm happy to discuss these projects later. So the EU-funded projects, they have to comply with the highest ethical standards and applicable international EU and national law, in particular the principles and values enshrined in the EU Charter of Fundamental Rights and the EU treaties. And those projects that involve development, deployment, and or use of artificial intelligence-based systems or techniques, they must demonstrate that their proposed approach is built upon the key prerequisites for ethically sound AI systems as defined in the ethics guidelines for trustworthy artificial intelligence by the high-level expert group on AI that I mentioned before. So this was research and innovation. If we now look at the support that the Commission is providing for the deployment of artificial intelligence in health sector, we have the digital program, which is the EU funding program for deployment of mature technologies. And here we support, for example, the deployment of the AI testing and experimentation facilities in healthcare. So these are large-scale experimentation facilities, both physical and virtual, where small and medium-sized enterprises who have developed AI solutions can test them in real-life environments. We have a big project, TEF Health, which has started in January 2023 on this. The Commission also supports a network of European digital innovation hubs throughout Europe, which support the rollout and uptake of digital technologies among SMEs and public sector organizations. And many of these digital innovation hubs are active in the health sector, and many of them focus on AI technologies. And finally, we also support deployment of pan-European digital federated infrastructures for health data. And these federated infrastructures for health data will enable cross-border access and federated analysis of different types of data. And here we currently support 3 such infrastructures. We support the deployment of a pan-European infrastructure for genomics data, a pan-European infrastructure of cancer imaging data, and we will be deploying a pan-European infrastructure of data coming from the intensive care units, ICUs. These deployment actions support the European data strategy and are aligned with the goals of establishing the European health data space. As you may know, in May 2022, the Commission has adopted a proposal for a regulation on the European health data space. This is the first sector-specific legal framework under the European data strategy that provides rules for organizing health data for primary and secondary uses. The overall objective of this regulation, of the proposal, is to enable an effective use of health data, both for primary care and for secondary purposes. The regulation will promote better exchange and access to different types of health data for both primary and secondary use. And secondary use, that is the data used for health research, innovation purposes, and for health policy making. And why am I saying this? Because we hope that this EHDS regulatory framework will drive the availability of health data for secondary use, including for the development of AI technologies. And we hope that the targeted actions, deployment actions that I mentioned under the digital program, will further facilitate the availability of large amounts of diverse, high-quality health data for the development of trustworthy, innovative health technologies. Because we know that the quality of artificial intelligence algorithms used in AI-based diagnostics and decision-making tools depends crucially on the availability and quality of the training data. And for developing fair, inclusive, and unbiased AI algorithms, we need balanced and high-quality training data sets representative of the European population. And these data sets need to reflect the racial, ethnic, and socioeconomic mix of the population as a whole. And this is necessary to ensure equal treatment in a digitalized healthcare system. And this is one of the principles for the trustworthy AI development, that an unfair bias must be avoided, as it could lead to marginalization of vulnerable groups and to discrimination. So here I would like to give a concrete example of one of these initiatives that I mentioned, and which can help address the issue of data availability for AI development. So in January 2023, the Commission launched the European Cancer Imaging Initiative. And with this initiative, we want to give researchers, innovators, and clinicians efficient access to more high-quality cancer imaging data, MRIs, CT scans, mammograms. And this will facilitate the development and testing of trustworthy data-driven solutions for cancer care. So this project is starting with 21 clinical sites from 12 European countries, and it aims to have at least 30 distributed data providers from 15 countries by the end of 2026. It's a 4-year project in this initial stage. In the mid-term, a distributed atlas of 60 million annotated cancer images representative of more than 100,000 patients will be available. Before concluding, I would like to raise one more important point. And this is important, I think, also in the context of this project that you have had. Convincing people to embrace the AI-based technologies in healthcare is a task that requires delicate balance. Beyond the regulatory framework for AI that I mentioned, and beyond supporting the health data reuse and research and innovation projects, we must communicate clearly. We must communicate not only the advantages that the AI technologies bring, but also address concerns transparently. And building trust is paramount. And this involves active engagement, clear communication with the public, demystifying complex technologies, and fostering an environment where individuals feel empowered, not threatened by artificial intelligence. And this applies not only to those who receive care, the patients, but also to clinicians who need to receive training, need to learn how to use the digital AI-based technologies. The Commission is supporting a number of actions aimed at improving citizens' digital skills, and we also have targeted actions on advanced digital skills relating to artificial intelligence and health, aiming at equipping healthcare professionals with the skills in the design, use, and development of digital technologies. And let me finish by saying that the Commission is committed to ensuring that the benefits of AI are harnessed to improve the quality and accessibility of healthcare services across the EU. And through its various programs and initiatives, we are fostering collaborative interdisciplinary research, encouraging multi-stakeholder dialogues, and creating synergies between research excellence and business and public sectors. And we believe that this can and will lead to innovation and socio-economic growth in the health sector. And the REINITIALISE project is an example of this and the collaboration and the interdisciplinary dialogue that we are supporting. When supporting the development, deployment, and use of AI technologies in health, the European Commission remains committed to ethical principles, legal frameworks, and our shared European values. With this, I would like to finish, and I wish you all an insightful event, fruitful networking, and I will be here until the end of the day if you want to discuss any of the points I mentioned. Thank you.
Thank you very much. That was Aleksandra Wesołowska, Program Officer EU Policies. Ladies and gentlemen, Now we will see the project presentation. First, work package 1, Enhancing Scientific Excellence, Professor Benedetta Giovanola, University of Macerata. Please welcome Professor Benedetta Giovanola. Big applause, please.
So how does it work with the slides? Do you have like a remote control? Or?
Yeah, there is a remote control.
So this one, like to go forward. Okay, so good morning, everyone. It's really a pleasure to be here, and it's also quite moving to speak at the end of this 3 years long project where we have been so much cooperating with Ilona and all the team from UMCS and also with the colleagues from Leuven. Now, I was listening with a high degree of attention of the previous speech because we tried in the project to really focus on this idea of trustworthy and human-centered AI for the health sector, and in particular for e-health devices, but also for the digital communication on health-related matters. So the first work package of the project was actually aimed at enhancing scientific excellence. So basically, at doing research on some of the topics that were mentioned and raised also in the opening keynote speech. We tried to focus on the ethical and legal and communication-related requirements of AI systems for health in such a way that would, above all, raise the research profile of our Polish colleagues, as it is the aim of these kind of twinning projects. And we organized a series of knowledge transfer activities from the Catholic University of Leuven and the University of Macerata towards our Polish colleagues. So the work package was divided into tasks that I listed here, but that I'm gonna describe very, very briefly. So the first task was the definition of a detailed plan for the transfer of knowledge and expertise. And to do so, we organized 4 academic symposia that were organized in the form also of brainstorming activities to try come up with interdisciplinary and intersectoral meaningful topics related to the broad topic of fundamental rights, ethical principles, law requirements in AI devices for healthcare. And so through these academic symposia, we come up with a detailed plan for the transfer of knowledge that then has oriented our further activities, especially in terms of exchanges between early-stage researchers and senior researchers through mobility programs, and also leading to joint publication. One of the focus has also always been the focus on early-stage researchers, so try improve their potential for research in an interdisciplinary, intersectoral, and international environment. So after having defined this detailed plan for the transfer of knowledge, we started with the mobility program of senior researchers, and then with the mobility program of early-stage researchers. The mobility program of senior researchers comprised 2 phases, and let's say an ongoing phase where researchers, Polish researchers would come to the University of Macerata and the University of Leuven. Basically 6 senior researchers came to Belgium and to Italy, and the outcome was an increased research profile. 12 senior researchers were involved in total in the mobility program, and all academic institutions institutions have been involved in that, so providing mentoring and supervising. And then through these exchanges, we and the research carried out jointly, we covered 3 interdisciplinary research topics. First one, the ethical and legal principles that would steer the design of e-health application. Second, the communication, especially digital communication on health on the digital media. And last but not least, the economic and social impact and the consequences of the technological innovation in e-health, especially the AI-driven one. To foster that, we also organized the scientific workshops during the mobility exchange. Here, all the outgoing and incoming researchers were involved. We organized 13 scientific workshops from October 2021 to May 2022. And then, so in our host institution, so in Macerata and in Leuven. And then for the second phase of the mobility program, when researchers from Macerata and researchers from Leuven then came back to Poland, 6 scientific workshops have been organized. These, as I was anticipating, regards the increased profile of experienced or senior researchers. But then one of the strengths of the project, so something we have constantly been trying to push forward, is the increased profile of the early stage researchers. So we also tried to boost international opportunities from them, and so 8 early stage researchers from UMCS, so the our Polish colleagues were involved in this mobility. They came to Macerata and Leuven, and they were supervised by seniors in Macerata and Leuven. To conclude, all these a detailed plan of transfer of knowledge that we elaborated together with the mobility flows, both of senior and early stage researchers, the scientific workshops and the discussion we had, they led us finally to what was a milestone of the project, that is the elaboration of a joint research roadmap. So based on this and based on 6 internal meetings that were held with the UMCS leadership from July 2022 to February 2023, we jointly elaborated this research roadmap that was, of course, shared with all the project partners, and that was tailored on the specific needs of the Polish institution. And so the roadmap was aimed at defining also a short-term, medium-term, and long-term perspectives and ideas of cooperation and further steps to be taken in order to further enhance the scientific excellence of the institutions involved, and especially of UMCS. So it comprises one section that is really developing a roadmap strategy focus on UMCS that defines its vision, mission, the objectives, the activities to be carried out also in a long-term time frame, with the aim of providing a long-lasting impact on the whole university with a cross-cutting impact as well. And then the second section details more specifically the way in which the cooperation among partners could and hopefully will be fostered. So it's a project partners roadmap strategy and an action plan. So we didn't just clarify what the mission, what the aim of this cooperation would be, but we also tried to define some activities, for example, joint cooperation in a further project, other activities that would involve still the exchange of expertise and of researchers. And these plan and strategy was defined designed in a mid-term period perspective, so a 5 years framework. And so the activities that we detailed and shared together comprise a joint cooperation in different areas, always framed in the broader context of and in consistence with the roadmap strategy that had been elaborated by the UMCS leadership. And I think that's all. And just to conclude with, and also before we give the floor to Hannelore for as a leader of work package 2, all these enhancement of scientific excellence was also meant to create some background conditions to further foster a transfer of knowledge and also to increase the innovation capacity of the whole ecosystem surrounding UMCS and also the ecosystem of the partner institutions. So also in the light of, like transferring the knowledge to the market and to the society in order to foster an economic and the societal impact of our research. And I think that's it, and thank you very much for your attention.
Thank you very much. And now it's time for work package 2, boosting innovation capacity, linking researchers to the stakeholders. Dr. Hannelore Strauven, Q11. Please, big applause.
Okay, so good morning, everyone. Work package 2 was all about boosting innovation capacity, and we had actually 3 specific objectives here: to increase the capacity of collaborating with stakeholders. The second one, to enhance the capability to exploit research findings into the market and public services. And then the last one, to boost participation of stakeholders in research and innovation activities. So this work package had 4 tasks with a lot of activities, which I will explain in later slides, but just to have the overview, we started with showcase events and a peer review session. Then we had some lunch and learn events and a winter school. After that, we had the venture lab, and we actually ended with a strategy for socio-economic impact. So we started with 2 showcase events, one in Belgium and one in Italy, where stakeholders from KU Leuven and UniMC actually shared their experiences about their collaborations with these universities. And after these events, where we invited people from the Uni Lublin, we had a peer review session. In this peer review session, we asked the people from Lublin to reflect first individually on these showcase events. So what was the things that they took home with them about these shared experiences. In this session, we then had a clustering of all ideas that came out of this. We also tried to categorize these ideas, and we asked to select a top 5. And from this top 5, we then created an initial plan, which led to a strategic integrated plan, some document actually, a deliverable here in the project, that we use for the further activities here in this work package, as well as an idea of how the university could continue afterwards. So what were like some main ideas that we had after this session is that it is a process to build relations with stakeholders, and it is also based on their needs analysis. That it is important to have an intersectoral cooperation. So we had needed the involvement of other entities, like from the university administration, NGOs, or business. It's also important to have some social activities to broaden relations with stakeholders. And we should not forget students and graduates, so we should create opportunities for them to be involved as well. So after we created this plan, we started with the lunch and learn events. These were 3 events which took half of a day. Here the purpose was to present the research lines related to the project that may be of interest to local stakeholders. We wanted to stimulate these local stakeholders to share their needs with us in the field of e-health services. And we also wanted to increase the awareness of the role of research for innovation and socio-economic impact growth. Also we had still some activities coming, so we wanted to propose their attendance so for research collaboration through the participation in the Winter School and the Venture Lab. As I said, we had 3 events, and we divided it into the categories of stakeholders. So the first one was for the decision and policymakers. The second one was for the association of users and foundations or NGOs. And the last one for more the companies and the industry. Another part of our second task was a winter school. This was a 1-week event where we had a lot of training with participants that could be academic staff from the university in Lublin, as well as the local stakeholders. They were invited as well. And we trained these participants in knowledge and soft skills that we thought were necessary to prepare them for the Venture Lab collaboration. Which were these trainings? They were about the e-health, so about research collaborations, legal and ethical aspects, and so on. Also about innovation, so give them an idea of different ecosystems, to some guidelines and methodologies that you could use, open data, a business canvas model, and things like that. And we ended with soft skills like pitching, presentation, and brainstorming. So after the winter school, we were ready to start with the Venture Lab. This was from November 2022 to September 2023, so it was quite a long activity. During this Venture Lab, the researchers from Uni Lublin also get support of and guidance from mentors, which were 2 from KU Leuven, Greet Bilze and Mark van Aken, and 3 from UniMC, Nicolo Testi, Giacomo Gistri, and Dominique Lepore. The Venture Lab was divided in 2 phases. In the first phase, we had a series of sessions to present the research to the stakeholders and also to brainstorm on possible research lines for collaboration. The 5 research lines that we then defined were the first one on autism, dyslalia, and revalidation classification models. A second one on patient-centered support for people with special needs. A third on training on e-health tools for all adults. A fourth one on health-related communication to people that are normally difficult to reach. And a last one on first aid in the digital era, implications to the health security. The second phase was then the actual collaboration between these researchers and their stakeholders, but I'm not going to give you more about this because we have a presentation in the afternoon about the outcome in this phase. So please stay and join us in the afternoon. But this work package ended with a strategic plan for socio-economic impact in the field of e-health. This document was defined or written via a strategy building process. So first we analyzed external and internal situation so that we could boost the relationship of the university with the stakeholders, as well as enhancing the entrepreneurship. Then we formulated a strategy based on a set of actions to carry out in a 5-year framework. So we did not only think short term, but also looked at this long term. And a third point or third step in the process was to ensure that there was an effective monitoring and control of these actions by defining some KPIs or key performance indicators. And at last, it is always important to revise and adjust this discovery process and the actions suggested. So this was what we did in the second work package. I think we can go on to the third one now. Thank you.
Thank you very much. This is the time to see the work package number 3, Digital Tools and Traversal Skills to Sustain Excellence, Dr. Claudio Carlone, Eurocentro, and we will reach Dr. Claudio online. I hope we have a connection right now.
Can you hear me?
Yes, we can hear you. Yes, you can
okay,
start.
thank you. Sorry, there was a small delay. First of all, I would like to excuse myself not to be present today as initially planned. I want to say hello to all the participants, and I will immediately share my screen to show my presentation regarding work package 3. Okay, just a second. See. I hope you can see the screen. So, first of all, I would like to say that what was about the work package 3. The work package 3 was related to provide the project and the participant with the right instrument and competence in order to enhance their capacity to sustain excellence. We see from the previous presentation the very interdisciplinary approach that the project was following. So it was important not only to focus on the research innovation aspect, but also to foster some competence, both to researchers, but as well as staff of MCS, to create the good condition in order to allow those innovation and research to deploy, let's say. For this reason, in this work package, we had 4 tasks. The first task was related to activity, was related to create a platform, a knowledge platform that will that has allowed our participants to transfer their expertise, sharing the practices around the project, and also to try to interact in the best way possible. The platform, here you see the image from the website of the platform, has 3 sections, one dedicated to mentoring and networking, another section of the platform is dedicated on the training activity that we carried out, another one on resources that can be useful for participant and external subject that link to the platform in order to have access to our resource and document. A second task was related to interdisciplinary enhancement, and as we have seen the project...
Excuse me, can I interrupt you? I hope you can hear me. Because
yes.
Can you do a full screen of this presentation? We don't see any next slides of your presentation. It would be easier for us to see everything. Okay,
sorry.
Thank you. Thank you.
I will check how to do it because I'm not sure.
We are right now at the slide 2, and we are seeing the PowerPoint full screen. Not full screen, the whole window.
Okay, sorry. We'll try. Probably is this one? No. Which is the one? Because I'm not very useful.
I think it's better right now. Not the best. We see the work package 3 digital tools and traversal skills, task 3.2 right now.
Yeah, exactly. Yeah.
Okay.
So regarding the task 3.2, as I was saying, is related to the interdisciplinary enhancement that is such important as the interdisciplinary nature of our project. In this sense, 5 booster sessions was organized in connection with each project meeting in order to allow the participant, the researcher involved in different phases of the project, stakeholder, and also staff of UMHS in particular, in order to understand how to better work together. We know how much is difficult to work together when we are coming from different disciplines in terms of languages, approach, methodology to be used. And also some good examples were presented. For example, I remember the presentation or the intervention about Institute of Future about from Kiel Leuven. Then task 3 was devoted to try to enhance the capacity to attract and managing EU funds. We know that the capacity, the availability of funds and also the capacity to collaborate at international level is extremely important in order to enhance innovation and research. For this reason, a specific set of activities were foreseen and realized in order to improve the capacity of first applying for extra European funds or European project, and second, how to manage them once the let's say the project has been approved. For this, we realized a series of workshops, a series of webinars, and one summer camp that was realized lastly in September, including 2 short-term visits that involve staffs. It's very important to say in those other training activities related to task 3.3, where aim to train both researcher and staff, especially from OMCFs. Finally, two intensive training courses were realized in year 1 and 2 of the project related to transversal skills, for example, both on research and innovation, like, for example, gender dimension, diversity, IPR, etc. Finally, I want just to spend 1 minute extra to results of those activities. More than 50 staff and researchers from, especially from OMTS, but also from UNMC and Leuven, take part in those training activities. In general, there was a very positive feedback on the training activity that we received. We monitored the satisfaction rate and was almost in all events very positive. Another element that I would like to underline is the importance of the participation, not only of the researcher, but also of the staff of MHS, is in terms of to improve their capacity to support the innovation research process within the institution. Because we know more and more how important is the importance of the presence of facilitator within the institution that can help research in developing the research project and then implementing them. And we want also to underline that at the end of the project, already 2 new projects has been jointly developed by the partnership. I would like to mention Ascent, which make part of the third pillar of Horizon Europe on capacity building of technology transfer offices. Another project within Jamonet Chair, EDIT, the name, on ethical aspect and digitalization. I think these are important signal about the capacity to achieve an impact of our works in our project. Lastly, and I will finish with this, I want to thank really the collaboration of these 3 years with our partner from OMTS, from Macerata, Leuven, was really a wonderful experience to meet these wonderful people and experts and to share this pathway together. Thank you very much.
Thank you very much. That was Dr. Claudio Carlone, Eurocentro, and now it's time for package number 4, and this is communication and dissemination. Dr. Ewelina Górka, UMCS. Please, big applause.
Good morning, everyone. My name is Ewelina Górka, and I would like to tell you something about communication and dissemination work package. On behalf of Kamil Fil, who is a task work package leader, I would like to say something about the communication process. So I just prepared presentation, I think. Yeah. The aim of this work package is to sustain a wide communication and dissemination of project outcomes and results to relevant stakeholders behind the partner organizations and territories involved, and to network and build links with relevant research networks, institutions, projects, and clusters. The specific objects are to disseminate project results among the community of potential users, to boost networking opportunities for Uni Lublin researchers, to involve relevant stakeholders in the process stems, stimulating collaboration with UMCS within the work package 2 activities and beyond the project, and to raise awareness of the general public about the benefits produced by the project, thanks to funding, of course. So this is information from our project agreement. Now I would like to show you something. This is a division of work package. We've got 4 tasks. First one is entitled Communication and Dissemination Strategy. And this is a document, this is a plan. Our strategy for project, for communication and dissemination, just like I said, and we use it to support partners in developing strategic in communication as well, and encouraging further transfer and use of project results. So we've got 3 revision of this document, and that's the most important thing about this plan. Next task is entitled Setting Up and Maintenance of Communication Tools. And I would like to say something about Toolkit because it was created by Claudio, by Eurocentro at the beginning of the project. So we've got a logo of our project. We've got a brochure in paper and electronic form in all partner languages and additionally in English. So you can see only small pictures, but trust me, we've got all 4 languages. We've got, of course, our roll-up that is very often used at public events and conference. You can see it next to this room. We've got, of course, a media kit which was used in relation with media, and 3 social accounts of the project: Facebook, Twitter, and YouTube. We also prepare a website of the project in English and in Polish. So I choose some slides, some screenshots. Yes, but this website is in 2 languages, in English and in Polish. And one additional thing, it's a promotional movie with cooperation, Claudio from Eurocentro, with cooperation with 2 students from our faculty produced this video. And I would like to show you this video if you want. Yeah, it's time for see this film. Can I ask for presentation?
Information and communication technologies based on artificial intelligence have a cross-cutting impact in many areas of our life, and especially in the domain of health. They also represent a key driver of innovation and digital technology growth. And information and communication technologies based on artificial intelligence have a cross-cutting impact in many areas of our life, and especially in the domain of health. For instance, privacy rights. They also represent a key driver of innovation and socio-economic growth. These technologies present new possibilities but also risks and challenges, such as the risk of violating ethical principles and human rights, for instance privacy rights and data ownership. These challenges can only be adequately tackled by developing an interdisciplinary approach where technology is designed in compliance with fundamental rights protection. REINITIALISE, Preserving Fundamental Rights in the Use of Digital Technologies for e-health services, is a European project funded by the Horizon 2020 Twinning Programme. It aims to step up and stimulate scientific excellence and increase capacity for the design and use of digital technologies in the sector of e-health in order to integrate the potential of technology with the awareness of its ethical, legal and socio-economic dimension. Thanks to the project, the Maria Curie Skłodowska University in Poland will engage in an interdisciplinary transfer knowledge process with 3 European leading institutions: the Catholic University of Leuven in Belgium, the University of Macerata and Eurocentro in Italy, and the continuous involvement of local stakeholders, with the ultimate goal of generating innovation and socio-economic territorial development in the health sector. The first phase of the project aims at strengthening and stimulating scientific excellence of the Maria Curie Skłodowska University through academic symposiums, transnational staff exchanges and research fellowships awarded to Polish young researchers. The second phase will empower and stimulate innovation capacity of the Maria Curie Skłodowska University in order to transfer research results to the market and public services. This will be achieved through international showcase events to share best practices, a winter school on innovation and a venture lab in Lublin, involving local relevant actors in jointly designing and implementing concrete collaborations in the field of e-health. The project will bring a number of innovative business ideas and startup proposals jointly developed by researchers and local stakeholders. Moreover, it will lead to a common research roadmap of the 3 universities in the field of e-health and to a Maria Curie Skłodowska University strategy for societal impact, defining ways to increase collaboration with local stakeholders.
Thank you very much. This film is available on our account on YouTube. So if you want to see it, you can easily find it on YouTube. Next thing I would like to focus on is communication with citizens, outreach activities and stakeholders. We organize some activities. First of all, we create a stakeholder list at the beginning of the project, in the first year of the project, just for communication. Another thing is organizing 2 face-to-face meetings during the project. So we choose foundations, companies, local public sphere, and you can see, for example, a slide which presents one of this event organized near to Lublin when I told people about new technology and e-health, and my listeners was the seniors, because it was a Seniors' Day. So another thing, it's organization of free road shows in public spaces of Lublin to reach and to interact with citizens. In that slide, you can see many things similar, but I have to say that it's a presentation of 3-year activities. So on the first, on the light, you can see 2021. In the center, it's a photo from Lublin Science Festival, which was organized this year. And in the right side, you can see, for example, me and my colleagues in 2022. Yeah. And the last thing, it's... Oh, no, sorry, it's not last thing. It's still communication with citizens and stakeholders. Participation to 3 very popular outreach events to present the project, one in Leuven, one in Italy, and one in Lublin. I prepared some information, so you can see the names of the events. And of course, general public will also was also reached through press and media appearances. Some examples are here, and here, and here, and here, and that's enough. Project presentation at third parties events was the almost last thing in that task. We've got, for example, one speech during the Lublin Accessibility Leaders for Start. It was a project, and Dr. Andrzej Juros was a panel leader. We've got communication activities during LubTech Digital Health Conference organized by Lublin Municipal Office Strategy and Entrepreneurship Department, and of course Medical Cluster. It was 2021. Another thing, it's active participation. Our colleague Diana Skwarzyńska during the online meeting devoted to innovation in medicine and health. And that's enough for this task. Last thing, it's a project dissemination. In order to disseminate project results, we've got, of course, participation to conference and events organized by projects, by other projects linked to reinitialize topics. We've got also papers. We are now just at the end part of the process of submission, of finalizing and submission of papers, because at least 6 papers in open access should be written in co-authorship with researchers from KU Leuven and UniMC by senior researchers, and at least 8 papers in open access written by early stage researchers from UMCS. And the last thing in that presentation and in task about project dissemination, it's a European conference and brokerage event. So today we have it. Thank you very much for your attention.
Thank you very much. Ladies and gentlemen, we will start the press conference right now, and it will be till 12 o'clock. It will be downstairs, in the room downstairs, but another very important information is it's also a coffee break. So we will meet again at 12 o'clock. Thank you. start the panel discussion on e-health development, digitalization in healthcare, different perspectives, and possible threats, use of AI in healthcare, digital maturity in healthcare system. Please welcome our speakers, Professor Bart van Roomste, Q11. Please welcome Mr. Bart van Roomste. I hope he's with us. He will be. Professor Benedetta Giovanola, University of Macerata. Please welcome Professor Benedetta. Professor Alessio Bartolacelli, University of Macerata, University of Modena and Reggio Emilia. Marzena Strok-Sadło, Lublin Medicine Medical and Wellness Cluster. And Łukasz Gołąbek, Netrix Ventures. Zapraszamy. Please welcome everyone. Thank you very much. So the first question is about the pandemic. It accelerated the development of e-health. Are crises the only chance for development in this area? And I would like to start with Marzena Strok-Sadło.
It is not about crisis, I guess, but it is more about the trends in general. And everybody of us, we know that we suffer of a lack of resources, for example. And just to tell directly, the people in, for example, in e-health sector, so the technology may support or replace them somewhere. Of course, everybody of us is expecting the high quality of treatment, and it is not possible with a support, without support of new technologies, of course. But it is necessary to stress that the crisis, of course, except of the trends may speed up the technology development, of course.
What about this question for Professor Alessio Bartolacelli about the pandemic accelerated the development of e-health?
Thank you very much. Yes. Well, my perspective is the perspective of a lawyer. And there is an old say by Jean Monnet that was saying that Europe was built after the crisis, and that crisis boosted the European Union itself. And I think that this is true for all the legal sector in particular, also when it deals with the pandemics and when it deals with the e-health sector in particular. In this respect, I think that, yes, it accelerated. I'm not sure if it is the only way. It is for sure the quickest way, because we were put in front of a challenge, a big challenge, and we needed some swift tools in order to overcome this challenge. And so from this point of view, I think that, yes, of course, it accelerated a lot. There were a lot of legal tools that were developed during the pandemics. I think that the big challenge that we are going to face is whether these extraordinary tools or these exceptional tools are going to be implemented as ordinary tools at a certain point. And I think that it is reasonably this way that is going to work, because once that you have already made so many efforts in order to overcome these difficulties, at this point it is very hard to go back and to step back. And so, yes, of course, it accelerated. We developed a series of legal tools, and also from the financial point of view, for the financial development of e-health instruments also. And this is something that comes from the European Union, but also is going to be implemented by the member states. And so, yes, definitely, yes.
And very important information for all of our speakers today. If you want to say something about the topic that we are asking, just feel free to do it, okay? Thank you very much. The next question is, what is digitalization in healthcare? Is it our future? What do you think about that? That could be a question also for Mr. Alessio Bartolacelli.
Well, it depends, because when we deal with digitalization in healthcare in general, we have to take into consideration at least two different subjects. I mean, we are dealing with the patient on the one end, but we have also to deal with the healthcare facilities. My personal experience is the lawyer experience, but also the business lawyer experience. And so I think that there are many ideas on that coming from the world of legal sciences also. Because when we think about e-health, we are facing a lot of issues dealing with ethics, of course, but with data protection. But also, let's think about patent law. Let's think about intellectual property and so on and so forth. And when we are facing some mixed area that is both public and private, we have also to take into consideration this. And so what are the instruments that the patients have in order to have a dialogue somehow with those healthcare facilities that are taking care of their health, but also taking care of their sensitive data? And these data are something that is extremely valuable. And of course, the European Union is doing a lot in this respect, because the European Union has a comprehensive regulation regarding data protection. But we have also to move on with a further step that is, okay, and what the private sector could do in order to have the patients and the customer as patients as effectively involved in the decision system of the companies and all the healthcare facilities. So are there instruments in order to listen to their voice? Are there instruments in order to make them interact with the healthcare facilities? I think that this is the further point that we need to take into consideration.
I'm going to pass the voice to Mr. Bart van Rumster.
Digitalization in society is sort of progressing, and we saw it in the service area of industry where digitalization came into the service. We see it in education, digitalization in education, and we see it in healthcare as well, the digital. So it's a non-stoppable thing where we transform these different areas with the availability of computers, digital availability of data. In healthcare, for example, if you look at the global south, where you have a lack of medical staff, skilled medical staff, digitalization could be not a solution, but a way to overcome or to support a solution. For example, if you take a medical image and there is no radiologist to analyze these images, well, you're nothing with. So if you can sort of introduce there a module such that these radiology images digitally available can be analyzed automatically and can make a suggestion to a radiologist, instead of having one or two patients an hour, he can maybe be more efficient, can maybe have 8 or 10 or 20 patients an hour, and also tackling the lack of these experts in the global south, for example.
The same question, I will repeat it. With what is digitalization in the healthcare? Is this our future? I would like to ask Marzena Strok-Sadło.
Because so far we have mentioned the digitalization on the level of interaction between the patient and the doctor, and it is usually what we are thinking about when talking about this digitalization. But digitalization in e-health, it is digitalization of processes in the system in health management. From this point of view, it is necessary when we are thinking about the proper management of all resources and monitoring what is going on generally in the system. So it is on the government level and on the local level, on hospital level, and it brings, thanks to such kind of tools, it brings better quality in management as well in the system of e-health and health.
Thank you very much, Mr. Łukasz.
From my point of view, the digitalization is obvious in every branch of our economy. nowadays we know that we don't need any paper documents. It's in the era of artificial intelligence, it's not efficient. It's really hard to process, so every document in the near future will be digital. There is absolutely no need for paper documents, and in medicine, especially for patients, they are losing the documents, and it's better to get them like a digital copy of the documents, and it's obvious that it will be the future.
You just start answering my next question, because I would like to ask about the quality of life, about how the technologies improve the quality of life, the quality of not only doctors, nurses, and patients, of course, but everyone. And these technologies and influence the understanding of the disease in general. Can I ask this question to Ms. Marzena Strok-Sadło?
Okay, so may you repeat the question?
How do technologies improve the quality of life and influence the understanding of disease?
Because these are, from my point of view, these are two topics. And first of all, the quality of life. Of course, if you use technology, so we generally involve less time for working, so we can gain the free time. So for example, general for development. And the next topic is how the technology can help to understand diseases. We can look at this topic from 2 points of view, from the patient point of view and the doctor point of view. And for a patient, it is, for example, it is opportunity to use technology as an education tool, and has to have easy access to the knowledge about the diseases, but also about the treatment opportunities. And from the doctor point of view, for sure, it is the tool which can support him or her in diagnosis. The tools which can be used to use more effective time which is spent with the patient, because, for example, new technology may help him, first of all, to support him in diagnosis in general, may help him to make notes, for example, and to send the information to the system. And so the doctors may save the time and have more time for the patient.
I see you want to add something in this topic.
Yeah, not only, so I think you have automation of complex routine tasks. I think technology can help with that, but also unlocking new insights in the patient's disease. For example, what we're thinking of is digital biomarkers, which are coming available due to the fact that you have everything available in the digital in zeros and ones. And for example, to give an example, we developed to quantify freezing of gait in Parkinson's patients. Freezing of gait is standing still, although you want to progress. That's a manifestation of Parkinson's disease. And to quantify, you can quantify this very well, but it takes a lot of time for doctors to look in a certain protocol, gait protocol, to quantify this. But if you automate this data, and nobody does this because it's too time consuming, but if you can automate this and you can give a device with the patient at towards his home situation, and you can do this automatically, and you can bring this in the medical file. You add a digital biomarker that is able then for the doctor to act upon. So that's a sort of degree of the level of the disease. And if you see it's stable over time, maybe the titration of medication shouldn't be changed. But if you see it's worsening, maybe there is an incentive to change the therapy or the drug therapy, for example. So it's really giving more info to the doctor about that particular patient due to this digitalization.
So we gain more time, we gain more accurate results of going to doctor and do some research. But yes, Professor Alessio, you have something to add?
Yeah, if I can just add my 2 cents. When it comes to the the final beneficiary of the information, and I'm thinking about the patient in particular, I think that it is very much important to think about what kind of a patient we are thinking about. I mean, with the full digitalization, I perfectly agree with what Professor Strokersad was saying before regarding patient and doctors. But a young patient is by design more educated to a digital world. If I'm thinking about an elderly person, an old person, perhaps the fully digital, for instance, the full digital medical environment is something that could be a bit frightening or even scaring. And so, well, it is a long-lasting process, in my opinion. It is something that is absolutely beneficiary to the healthcare system as a whole, but it needs a progressive approach in order to not to leave back the people that could be more in need of getting this medical information, as they are not educated very much from a digital point of view. This is something that also Professor Van Roost was stressing before, and I like to stress it again. It is a matter of education. Everything starts with education, with a digital education for the people, and we need to find a way also for a progressive education also for elderly people that are not by design so digitalized. So it's some kind of a reinitialization of their digital literacy as well.
It's all about my next question about the patients. Do they follow those changes in healthcare? Do they use those medical gadgets, medical tools that we have some new gadgets like, of course, smartwatches, smartbands. They counting our steps, counting how much water we are drinking every day, and even when we are sleeping, they counting how we are, how our breath is, and it's very important. It's a very good message to us that we are sleeping well or not. But do patients follow those new tools, new gadgets, new changes in healthcare? Maybe? I can ask this question for you, Professor Benedetta Giovanola.
Yes, thank you. I think they follow it in as far as they trust it. So it's very, very important to have their engagement already in the phase where these technologies are defined and designed so as to make them not only in a way which is user-friendly, so which is like easy to use, but which is also understandable to them, and so kind of explainable to them, so that they know, for example, that these technologies have been designed in a way that would protect their data, that would enhance their well-being, that is really useful to them. But in order to do that, it's important to take their needs and expectations into account from the very first phase, because otherwise they would either not trust these systems and so not use them, or find tricks. For example, I remember a video that once Bart has shown here, exactly in this place, of an elderly, so a senior person, that probably in order to make his children, grown-up children, happy that he was using these smart devices to monitor his health condition, was trying and succeeded actually in finding all kinds of ways, you know, to tricks. To be a sort of free rider, you know, so not really use them properly because he didn't trust these kind of technologies, and so, but he didn't want to disappoint the person who cared of him. Now, of course, I can't describe it in such a powerful way as the short video was, but it is just to say that if people and their different needs, so patients and their different needs, and also their way of communication, their expectation are not taken into account already in the design phase of these technologies, either the people will refuse to use it, or they will trigger different tricks not to effectively make use of them. So these technologies can be really useful, but needs to be designed, developed and deployed in a way that takes all these needs and expectations into account to be successful, I would say.
Next to that, there's also an element there that some companies want to go very fast to the market and sometimes produce devices that are not fully validated, even for their core thing that they want to have. And that's something we encountered as well in our research group, where people use devices. I think Hannelore is an example of that. Hannelore Stroven has used devices that were on the market that promised something and that they couldn't deliver on what they promised. So that's also not stimulating uptake of these devices. So what I would then advocate is to have a sort of thorough validation of the devices before they come on the market.
Ms. Marzena, Stroxadło, you would
what
like
I
to
would
add
like to stress,
something?
because usually, as I already said, when we are talking about digital solutions in e-health, we are thinking about different devices or gadgets. It is one side of e-health, but we can't forget about system solutions, which different applications, which can help patients, for example, to have an access to the e-health system. For example, like in Poland, not only in Poland, there is e-health center, and which is managed by the government, and from the patient level we may have an access to our internet digital account to have a prescription, to monitor our visits with the doctor, etc., and it's developing all the time. And I read the report prepared by the Ministry of Health. It is very interesting because we do not think we are very, we accept very easily in Poland digital solutions, but still more than 70% of people in the age from 16 to 75 use the public services in different scope and different kind of services by internet. So it is quite optimistic, and there is quite a huge dynamic during last 2 years. So for sure, if we can, of course, everything what has been said about the devices, and what are the advantages and disadvantages, and what influence that in results is very important to remember about that. But we should remember also about the benefit of access to the healthcare system by internet, by patients, but also by the doctors and medical services providers. So on each level of management of the system, on government level, on local level, and on the level of individuals, as I said, patients and doctors.
But what about elders? Because my mother always said that her whole life she go to the doctor and she didn't need any internet. So why would she use it right now? Why would she need it? What about threats? What about challenges, and how to support seniors in this digitalization? Mr. Alessio.
Oh yeah, my mother as well. So I think the problem is exactly
Good
this.
for you.
No. More or less. But yeah, the problem is the same. I mean, it is the mix between the digital part and the physical part. it is very good to have everything online because great, nothing get lost. You have all your stuff, you have all your medical data in one place, and it's great. It's great for you, and it's great for your doctor, because by this way you are not forgetting to take that old prescription that you had 5 years ago, because the doctor already sees it. We have a similar system to the Polish one also in Italy, and it is great also for our family doctors. But there is a family doctor. I mean, when you are going to monitor your healthcare, yes, you have these devices. Well, my contribution to the previous question also, it's very interesting because what we have at our wrist is something that measures a lot of things. But the key point is that are we educated enough in order to understand what's important and what's not that important? And the good challenge now, the great challenge now is for the applications that are getting this data and are teaching you what's more important and what's less important. The algorithms that are measuring your health beta and so on and so forth, and the level of oxygen in your blood, and how it is going. And that's good. But if a younger person can get this information from the application that you have in your smartphone, not always this happens for our parents, for instance. And my parents, well, I told them, well, you can find everything online. And they say, okay, but if I go to my doctor, he can understand what's important in what I can find online and what is not. So, yes, in my opinion, it is always a matter of balancing these topics, balancing these issues. It's extremely relevant to have digital healthcare system, or as much digital as possible an healthcare system is, but having also the capacity to understand the most important data. And for this, there are the physicians, there are the doctors, in particular for senior people, of course.
Can you tell me how to support seniors, how to educate them, how to help them to live in this digital e-health world?
It depends because, well, it's a multi-level governance issue. I mean, the key topic would be a general digital education. This is the starting point. Once that they can switch a computer on, at that point you can build on this also the e-health system. And so, well, it's a matter that public or social enterprises should be taken care of in order to promote this kind of a digital increase in their skills and in their capacities. But this is also something that is a challenge for who designs these applications, because these applications should be multi-level, these two, because there could be something easier for people not so much involved in digital issues, and something more difficult for those that are much more in that sector. I think that there is still room for improving that.
If I look at it from a technical side, we can make beautiful apps to do fall detection, for example, in elderly, and we did some research on that. But then and that could work very good and very robust. But then you have to integrate it, for example, in a care path, and that's also very important because, for example, if you go in a nursing home and you have this device working, but you have to carry 4 or 5 mobile phones to see what's on there, and then you have the communication device. It's not practical for the nurses as well. So you have to look at it. You can have a nice app, but how do you integrate this in the total care path, such that it becomes a tool that can be used without too much overhead, and then interoperability between different software packages is important, so that you can smooth out and that you can use the device along with other modalities that are available, maybe from other vendors. So that's also important.
But can you tell me this is a problem not only in the elder patients, but also to the elders, doctors and nurses? Yes.
it's in the entire industry and in other industries as well, that if you use different tools from different vendors, that they can work together and that it makes a system usable and makes the care path not more demanding, but less demanding for the nurses, for the patients, for the doctors.
It should be easy for everyone.
That makes it easier for it, and that's why it's important not only to look at the device and what the functionality of the device, but also at the path in which the device, it's the care path in which it is used.
Okay, but we've been talking about the quality of life, about the e-health, but what about quality of medical services? Are they growing up? Are they better with the medical digitalization? Maybe Marzena Stroksadło.
I have been looking at Łukasz. Yeah. So I will start and you will continue. Okay, for sure. First of all, opportunity of remote monitoring, for example, which can deliver additional data to the doctors, and it is very important. And it could be, for example, good example for diabetes, that they may have the sensors which control what is going on, and then the doctor may have the proper information during the visit, because we are, as people, we are not perfect, yes. So the doctor may collect the proper data. And I guess that any new technology and any new medical devices which support doctor and is very useful, and it improve the quality of medical services in general.
Maybe, Mr. Łukasz?
But there are also bad sides of, especially for telemedicine, where there is no relation between the patient and the doctor, and there are a lot of researchers that show that people after the digital visit don't feel comfortable, they don't feel secure, so they need more help from their family. They feel that they should go to the doctor to, that it's better if the doctor will see them in person. So also the quality of telemedicine visits, it's not always good. There are also some researchers that show that the doctors feel very tired because they have a lot more patients when they are use telemedicine, so they are not focused on everyone because they don't see them in person, and actually they care less. But I know it's not good to say, but it's a problem in this system, how to keep the doctors engaged when they don't see the patient live.
You talk about telemedicine, but when I go to my family doctor, he's not looking at me, he's looking into the computer, because he has to enter a lot of that data about my health. And I think this is our next question. Is digital health the future in the healthcare sector, and can it pose any possible threats? I think this is one of the possible threats, that the relation between doctor and patient isn't that good as it was a couple years ago. What do you think about that? That's a question for everyone.
Maybe I can start saying something on that. So as I said before, there are huge opportunities, but there might also be risks or threats if the potential risks are not mitigated or prevented when it's good to mitigate or prevent them. So one of the major challenge is, I would say, how to integrate these systems in a relationship that needs to stay human-centered, and so to involve persons, and so how to use these devices in a way that would support clinicians, that would support medical doctors, that would support patients without replacing them. This I think is true in general, but it's particularly true when it comes to health, where the interpersonal and human-centered dimension is particularly important. Also in emotional terms. And then the feelings and emotions also play a huge role in sicknesses and when there are troubles regarding health. And then there's a second bunch of threats, I would say, or risks that might be mitigated and that are increasing due to the newest development of AI technologies like so-called generative or creative AI, large language models, foundation models, because there's a higher risk of involving some forms of biases in the training phase. There's an issue that regards the how the data that are used to train the system are representative, also how they are, what kind of data are available and in what amount, so as to train the system well. The other issue is whether they are representative of the population or whether they are biased in terms of, for example, representativeness of most vulnerable groups. For example, if they are gender sensitive, if they are biased regarding ethnicity. These are very, very common, let's say, kinds of bias that are still a problem in AI systems, and that might be even bigger in the new developments of AI. And then there are all the, let's say, challenges that are linked to what we were also we were listening to in Alexandra's speech this morning. So all the issues that regard the compliance, not only with legal requirement, but with ethical principles. So whether these systems preserve the autonomy of the people involved, whether they are, if not transparent, at least explicable, whether they are fair, so do not discriminate, and so basically if they are human-centered and trustworthy, I would say. These are probably some of the big challenges.
So digitalization, it has to help doctor and nurse, not to replace them.
It has to be a support, and I think one of the major problems why. One of the main reasons why we are discussing so much nowadays the creative or generative AI is because some people have the impression that it would replace humans by doing something that is not just predictive, as machine learning systems might be, but which is creative. And so also the discussion about, is it stealing our jobs, or is it like posing existential risks? Will we disappear as human beings, or in the best option ever, just say lose our jobs? And so I think this is very, very much important to try say how these systems are really for the support and so can really be integrated into the practice. Of course, considering that any technology also has a transformative power. It's not just an instrument, it changes the way in which we practice something, it changes the way in which we act. But the thing is that it ought always to be oriented towards something which is human-centered.
I'd like to once again read the question. Is digital health the future in the healthcare sector, and can it pose any possible threats? Ms. Marzena Strok-Sadło?
Yes, of course. If it's opportunities, always opportunities and a lot of advantages, but also sometimes many disadvantages and threats, as I said. And here, by Bernadetta mentions the example of AI technologies, and maybe I would like to stress as another example, virtual reality or augmented reality, for example, in rehabilitation, and. For sure, because there are many such a solution which have been introduced to the medical practice, or on innovators or companies try to introduce to medical practices. But what I may observe, even working with innovators of companies in the Lublin medical cluster, and that because it's general there is general understanding that if we, it should be general understanding that if you work on the designing or developing of new medical solution, we should involve the representatives of different disciplines. So we should represent the the most interdisciplinary approach in the designing process as it is possible. But in the practice, what I can observe that usually the innovators are working and developing themselves, the solutions, sometimes with very limited contact with end users, and even limited contact with the experts from another medical discipline. So, for example, we use even in Lublin, in hospital, virtual reality in rehabilitation of patients. But when discussing with another experts, we understand that some maybe disadvantages of this kind of rehabilitation should be considered. So, as I said, there are different sides of every solution, and for the future, and we all understand that this is interdisciplinary approach is the must, but in the practice we do not use that in practice. So implement this in practice. So it can be the danger, kind of a danger for the patient.
So we have
also
to be optimistic, but not hurrah optimistic, and we have to meet in a halfway.
We should be practical and understand the complexity of every development. But can you agree with me?
I agree, and I think we all have our own disciplines, and computer scientists, data and analysis have their own discipline. Clinical experts have their own, philosophers have their own discipline, but we really have to come together and we have to try to understand each other's language a little bit better. You don't need to make from a computer scientist a doctor, I mean a medical doctor, but you have to understand the language. You have to understand what they're talking about, and until a certain level, and that will help to build maybe a new generation of scientists and developers that can make these AI tools more compliant with the values that Benedetta mentioned.
Professor Alessio Bartolacelli?
I think that it is not just the future, but it is the present. I mean, we have already discussed this, and the problem, the opportunity is the fact that we have now available an amount of data that was unthinkable until 10 years ago, for instance. And so medical doctors can rely on all these data belonging to our bodies that were really unthinkable until not so many years ago. And this is an improvement for early diagnosis, for predictive medicine. Of course, it is great. And so it is an added value, a huge added value for the medicine itself and for the benefit of the patients. But the problem is, first, it is an instrument and it is not the final good. I mean, you always need the person to interpret these data, and the person is a physical doctor. And the person, of course, must be educated in order to get a good acquaintance of these data and how these data are obtained, and if they are reliable or not, because what Bart was saying before, not always they are giving you these smartwatches, for instance, because also when we talk about e-health devices, we must distinguish between the retail devices and the professional devices. And this is another big topic, because of course the professional devices must be extremely accurate and so on and so forth, while the retail ones not necessarily are. And so this is one thing to think about. The second thing is, yes, we are getting all this data, but we need good interpreters. It is like the stars and the shaman and the old times. And so, okay, what do the stars mean? And they are giving an interpretation. Well, doctors are giving an interpretation to something that is real. That's your health care data coming from different devices. What's the problem? The problem is that these data have a value, an intrinsic value, and they can be used for good purposes or for not that good purposes, or also just for commercial purposes. In these cases, well, there is a legal framework to be compliant with, because it is, of course, a matter of ethics, but it is also a matter of what is lawful to do with your data or not. If you can sell these data to insurances, for instance, and the price for your life insurance is changing according to your health data. Is it correct or not? I think it is something that we should think about. And I think that we are already, in the legal sciences, we are already taking into consideration these topics. But these have to do with our own lives and with our own wallets as well.
Okay, so this is the question for Mr. Łukasz Gołąbek about the cybersecurity, about the security of this data. Because we all knew people that they don't use Facebook, Instagram, because they will steal our data. We don't know who are they, but they will steal it. And what about cybersecurity in the e-health? Is it even possible to steal data? I think yes, but how to prevent it?
It's crucial. It's really For me, the medical data are crucial and we have to keep them safe, but it's really hard nowadays. There is a lot of systems for cybersecurity of the data, like encrypting and so on, but it can always be stolen, especially when someone will hack our computer or our iPhone or our phone. He will probably get the data, so it's a big problem, and we are still developing more and more solutions for cybersecurity, but they are always, breaking them in banking, in medical healthcare. It's the same. So it's a general problem with cybersecurity of the crucial and data. And actually, I see no solution for that. That's the risk that have to be taken into consideration. Now everything is in cloud, so everything can be stolen. So we have to live with that probably.
And cybersecurity means that we have to spend money for investment, for services, etc., etc. And it is always the question for the management, for example, of hospital. Yes, and if they have different groups of costs and limited budget, how to manage those spendings. So I'm afraid that not every medical services providers, at least at present, have opportunity to protect this medical data and the entities from cybersecurity, because
yes,
it means huge costs.
Yeah,
huge
but
costs.
the end user is the weakest link always. So if we will not protect our data, our personal data, they will get stolen. The medical data providers or big cloud companies, they really care about the security, but the end users don't. And that's the 80 or 90% of the data leaks are from the end users.
On top of that, I think every time that we talk about cybersecurity, as cybersecurity experts always acknowledge, there is something that has to do with the technical side of it. So to have systems that are robust, technically speaking, and systems that might prevent cyber attacks or stealing of data and anything. But one of the biggest problems, and so also one of the major sources of the success of cyber attacks is the human factor, what they call the human factor. So people that, for example, respond to phishing attempts, people that would receive email and click on the links that they get, people that would use devices without knowing that if they accept something or do something, this might be leading to a data breach and stuff like that. And for that not to happen, it's important to really educate people to an aware use of these kind of technologies. Otherwise, even if there's the best technical, let's say, device ever, still there will be problems that are related to the human factor, what is called the human factor.
It's like end user, as you said.
I like to look at it from the other side. If you all these machine learning models, they're hungry for data. So data is something and they produce new insights in medicine as well. So on the one hand, you want to protect your data that it's not widely available. But on the other hand, you want to provide this data maybe in a sort of annotated way or also to developers, researchers that can use this data to mine new insights to further develop the area of AI in medicine. So there is a bit of a field there of tension between privacy and availability of data for research. And then on top of that, if you want to, how do you provide this data, for example, in a company setting, if you want to make a product from that? Who owns the data? And can a company then buy or sell or lease or so that all these models to then provide companies access to this data should also be looked at. I think that's probably also more in a legal context that these things should be. But data should be protected, but on the other hand, data should also be freely enough to further develop the area of AI in healthcare.
Yeah, there are 2 points that I would like to stress. The first, from my background, I very much share what Marzena was saying before. I mean, cybersecurity has to do with risk management. When you look at it from the healthcare facility or from the company point of view. So the risk of data leak is something that is to be incorporated within the governance of the healthcare facilities at this point. Because there are so many data involved that this is one of the biggest risks that these companies and these organizations are facing. And so it is something that must be taken very carefully into consideration. Second point, I very much agree with what Bart was saying. I mean, the point is, would you leave 500 zloty on a bench in the park? No, no one of us. And why do you leave your data freely available online just because you don't think that they are valuable, but they actually are for someone? And so the point is to understand what is to be held as public as possible, because there are data that should be made public in an anonymized way, at least, for the public healthcare system, and some other data that should be protected by privacy. And so from this point of view, this is, again, a matter of education. To be educated, first of all, on the fact that our data are important. Our data are important for us, but are even more important for commercial purposes for other people. And there are some data that we should be aware that can be used publicly in an anonymized way in order to, for instance, have a better social security. If we think about this, the traceability systems that we had during the COVID times are this kind of data. The fact that someone was positive, was tested positive, and could be traced, because by this way you were preventing the pandemics to spread even more. It was something that was done for the benefit of the social security. Can it be done on a normal situation? Is it good to have this done in a normal situation? I think that this is very important to understand. Perhaps no, or perhaps for some data, yes. But it depends very much on understanding which kind of data and what we are willful to disclose to the public. And it is always a matter of balancement. It's always a balance.
But what about the data that we are given by ourselves? That when we are using smartwatches, smartphones, because we are thinking Google knows everything about us. And I like the timeline when they send me an email once a month when I was, what I'm was eating, and that's cool, but it's frightening. That why is he know that? Because I allowed it. And what about those smart devices? Samsung next year will release a smart ring and will be closer to our body because it will be on our finger and it will measure everything, almost everything. Can we trust these gadgets? Can we use these gadgets? And give data by ourselves freely?
Well, this is the best dream for all those that are managing data, so to have as well big data itself. It's it. The point is, do we really want to be measured? First, do we really know where these data are going?
No.
Because this is the problem. If they are within the European Union, we have a regulation. But if you are using a third-party smartwatch, for instance, giving the data to China, are you sure about how these data are going to be used?
Of course not.
Question mark. So, second point, how many of us care about that? Because the problem is this. And again, it comes to education. Because this is something that's important to understand if we really do care about where these data are going to be used. And the big problem is that these kind of regulations are regulations that are nation-based, not the European one, because we are 27 and we are all the member states in the European Union have the GDPR, and so all of us are under the same umbrella. But when you go outside the European Union, India, China, Pakistan, Australia, United States, well, actually, what are our data used for? In order to develop what? Is it correct, not correct? And this should be something that we should care about when we are purchasing the smartwatch, the smart ring, the smart glasses, all these kind of devices, because actually the place where these data are going to be stored has a relevance when it comes to how this data is going to be used.
Mr. Łukasz, do you have something to add to this topic?
Actually, no.
Okay, so
it's a topic of awareness, first of all, and when it is our choice, if you are aware how it can be processed, our data. And as I said, our choice, because I believe because we are more and more awareness of what can be done with our data. So some people are ready not to agree, for example, to deliver some data. For example, it can be a huge problem for clinical trials. And we can observe this problem in many countries because in some countries patients are more awareness and so they do not want to undergo so kind of processes. And there are a lot of clinical trials in the world, in the pipeline. So probably, maybe in the future, also by choice, some people will agree, will decide, I do not want to work. I will just sell my data, yes, for money. And it will be my, it will be the way I want to live, very comfortable. But being very conscious that I am living from my data with all consequences of that, probably.
Wow. Wow, this is something I've never think about that, and I'd like to do one big period after the topic, but there's going to be 3 periods because this is something new to sell my data to live comfortably to the end of our lives.
I want to add, like in this commercial device, this ring, for example, as a researcher, we always check how open is the system, because we are not so interested in the aggregated data that comes out of it, but in the raw data that is measured by the sensors itself on the ring. And that's always something, because there you can sort of set up experiments and explore the opportunities of these rings. And you see often with larger, like the Samsung Ring, that this part is particularly protected, and you cannot have access to that they do this by themselves, and that's a pity for as a researcher.
Okay, thank you. And I think there's going to be a cherry of this cupcake. I think about artificial intelligence. This is something that is very hot topic right now. And we had the great hopes in artificial intelligence when talking about patients, treatment, and healthcare. And what are your experience about AI in healthcare? It's still a question for everyone.
My experience is when everybody is talking about AI. But the question is how many people is still understanding properly what does it mean in reality. Even people who are working, for example, there are many, I am listening to some, people who are saying that they are developing and designing some solutions and medical devices, and AI is already involved in that as a part of that solution. But understanding the reality, I really do not believe that it is possible to collect the data for AI. So it is not possible that the solution with medical advice with involvement of AI really works. So. And probably because it is not easy to have the access to the data at the moment, for example, in Poland, because of the legal regulation, it is very difficult to have an access on commercial conditions, rather for scientific research only. So, as I said, this access is very, very limited at the moment because of the legal framework.
What I also noticed, if you talk about AI in healthcare, is that in the healthcare community is a rather conservative community. They're very critical for changes, which is good. I mean, you don't want to change things. So everything needs to be well considered before changes are occurring. So if you develop new AI algorithms on data, what can be more easy to convince healthcare community is that it's rather open and explainable, so that you can explain why you came to that particular decision linked to your input. What on your input was sort of triggering this decision at your output. That's sort of explainable framework for AI, and I think this is an asset that can be used, that can help to convince clinicians in building trust on the new technologies that are developed.
But how do you think we will use AI in medicine? It's going to be a tool? It's going to replace someone? What do you think about that?
No, well, as I said before, it's a part of automation of tasks, routine tasks, which can become more and more complex, so complex routine tasks. So this can help to make, for an example, just to make it more concrete, identify whether in this mammogram there is a cancer or not. And so this is, you have to scan so the mammography, and if you can have a sort of an algorithm that can indicate to a radiologist that maybe look here or there, sort of inform the radiologist of certain areas in the image that could be linked. A neurologist can build up trust, of course, and based on the build up trust, he can also go quicker through that particular patient, and can have maybe a larger throughput of patients. But there needs to be an element of trust built in, and that's why I'm saying that explainability is an element to implement trust in the system.
Actually, the artificial intelligence is used in medicine for years. Before it was so popular and a hot topic. There is a lot of AI algorithm used in radiological systems to improve the quality of medical image. They were used in the background to get the more precise image and do the reconstruction if you have 3D image. So it was used for around 10 years or 8 or so it's so popular. Even the Polish startup like Stetomi used some AI algorithm to improve the quality of signal. So you skip get the data better. So it was used for years. So it will be constantly used in more and more ways. Mm-hmm. For example, now there are systems that help to get notes from speech. You just use the speech-to-text software, and it also AI improved, and it has some algorithm in it. And later on, for example, ChatGPT or other language model can do a note from a speech. So it's quite common and it's widely used.
Sometimes it's better not to know what kind of technology we are using, and when we are afraid of artificial intelligence, that it's gonna replace something or it's gonna be worse than good. I think it's better that we call it just technology, not AI in this case. If you said that we are using it in a couple last years and maybe more.
Yeah, for example, for MRI image, there are a lot of algorithms, including artificial intelligence algorithm to reconstruct and do the 3D image from the pictures and so on. So it was used for years. So if you have a lot of noise in the signal, it was used, I don't know, for really a lot of years for that.
But can you see any ethical problems about artificial intelligence in medicine? This is the question for Marzena Stroksadło.
Yes, first of all, we can notice that when, somebody can use for device of a solution for algorithm the data, from not finding very legal sources, yes, because sometimes there is very low level of understanding, as I said, of legal framework still, because when I'm working with companies who are developing the technologies, and but the situation, of course, is changing from year to year, and I can see the progress. But mostly, they are focused on technology, more on technology, less on, for example, legal issues. Sometimes not. They forget even about the ethics or social issues.
Okay, thank you.
I think Benedetta has already hinted on that question. An important technical element is bias in data, and so that means that your data is developed for another task than it's downstream used, and you have to compensate for that if you want to use it downstream. An example, just to make it a bit more concrete, we have a lot of data from ECG, so heart data from Western world, huge databases that are available. But if you apply this to a use case in the global south, it doesn't work. It doesn't work because it has another profile, it has other, so you have to adjust this huge database with a limited amount of data that you have from the global south, for example, in our case on rheumatic heart disease, such that you can use these databases so to compensate this bias. So it's a sort of north-south bias you have in this data. Yeah?
Different client profile, patient profile.
A different patient profile in the south, and this disease does not exist anymore in the north, and it cannot deal with these huge data sets. Sure. So you have to adjust these data sets such that they can deal with this particular disease, rheumatic heart disease, and that is a disease from the global south.
This is what the topic is. The issue has been mentioned by Alexandra today in the morning, and it is the purpose of European program, yes, to collect the data of clients from all over Europe, for example, to use the solution in Europe, but the data should be collecting from patients of different profiles, yes.
Professor Alessio Bartolacelli.
Just one final line on the legal perspective as well. Insofar, artificial intelligence is an instrument, is okay, of course, but it must be an instrument for a better diagnosis. But we have a huge problem when it comes to responsibility, to liability. I mean, it is not, artificial intelligence is not to be intended as a safe harbor in order to say, okay, I am the doctor, I did not detect that disease because the artificial intelligence told me that there was no possibility. No, it is an instrument, but it must be developed together with other instruments. And so, of course, it is great. It has also an ethical implication. I'm not an ethicist, and so I'm not going into that. But the key problem from a legal point of view is whether having an artificial intelligence as an instrument of support can replace the responsibility of who does the final diagnosis, and who does the final diagnosis is the physician, full stop. So coming to your first provocation, that was, okay, is it going to replace someone? That means the physical doctor, I mean, no. In my opinion, it is not going to, because we need a person that is fully liable for what's happening. Liable for your health, but liable also from a legal point of view.
Yes, who will take the responsibility when patient dies, maybe, yeah. I was in a medical conference a couple months ago, and one of the ethical problem was one of the doctors says that when patient comes to him with cancer, of course he wants to be cured, but this is not number one. He wants to live with dignity. And he said that AI won't understand this because it's 0-1 program. It have to cure the patient, and it didn't care about dignity. It have to cure patient. So it's not important for this patient. For a lot of patients, they want to live with dignity, even though they won't be cured. So I think this is one of the ethical problems that we have to think when we talk about this artificial intelligence. What do you think about that?
So I think this kind of debate is misled by the fact that when we think of health-related issues, also the ones that involve AI, we used to frame them, I mean, in an ethical perspective, just relying on the main principles of bioethics. So the main principles of bioethics are, in fact, human dignity, autonomy, the idea of not harnessing people, so not maleficence and benevolence, this kind of stuff. These are extremely important principles, but these are principles that are meant to guide the medical doctor-patient relationship. And that's one domain. Now, the challenge is actually to bridge these bioethical debate that regards medical doctor-patient relationship with the AI ethics debate on AI ethics principle. Now, if we do that, we would also come to acknowledge that we ought to design, develop, and deploy also AI systems that would be compliant with the human dignity. So human dignity is not something that can just be preserved through a direct human-to-human relationship, but that could and ought to be also preserved and enhanced through this instrument. So this actually leads us back to the initial discussion we had. So how they might be, again, designed, developed, and deployed in a way that is human-centered. So I would not say, just to conclude on that these systems would take human dignity away. The challenge is exactly to develop them, design them, deploy them in a way that not only preserves but enhances that. If you say it cannot, in principle, you are just, I think, having a sort of not realistic, in a way, understanding of how even the profession of doctors is being changed, they will be changed through these devices. So the challenge is how to integrate them again and to design them in a good way, in a beneficial way.
So the human should be always in the center.
Oh, for sure.
Okay. The last question to close the debate is about the digital maturity in healthcare system. Do you know any examples of effective digital solutions that we are using today in Europe, maybe, for example? Do you can say something about this? Do you know any examples that they are working right now?
Good examples.
Yeah,
yes.
Of course.
I guess that first of all, Estonia is a good example because Estonia is considered as a country with the highest level of digitalization, if you can agree with me. And then Denmark and Spain and these are countries I had some experience with them regarding this system.
Do we know any more? Mr. Alessio? Maybe.
Yeah. No. As I am not working directly in the field, I have not direct experiences of digital maturity and how digital maturity can be achieved. I have the example of what's happening in my country, and I can speak as a patient and as a citizen. And of course, this is something that is improving very much. The fact that everything is in the cloud, and so in the national healthcare system, and everything is there, it is really something that is improving our lives. And in the sense that really we don't have to find these old document coming from 5 years ago, or I don't know where it is, and my physician can have a full description of what my situation is at a glance. And so really it is something that is going to give us a better health at the end of the day. The point is whether we are prepared for that. I think that I'm rather well educated in a digital way, and so for me it's not a big problem. For my daughters will be even easier because they are native digitals, and so for them it would not be a big issue. The problem again is with making this data as reliable possible in order to have better diagnosis from the offering point of view, and from the user's point of view having a good interface in order to get the data in a friendly or effective way. These are the challenges that, from my point of view, are the current challenges in this field.
Professor Bart?
Yeah, so I think the technological advances are going very fast. It's very difficult to predict in 5 or 10 years what directions are. Well, some can try to do these predictions. Hence, you can never be an adult in digital. You always stay a young adult who always learns new things as time progresses, because technology is always coming with new stuff and new directions and new competences that are necessary and new challenges for society.
In the 80s, sorry to interrupt you, we thought that 640 kilobytes would be more than we ever would use. Yes.
Yeah. So in this context, it's not a question or 0 or 1. You're adult or not. It's a continuous process. It's a continuous process, and to look what's popping up and that's interesting. I mean, I'm an engineer, and I'm of course interested in digital and technological new things, and it's a continuous process. It's not a 0 or 1. It's yeah.
Yes, and there are, if we are talking about the digital maturity, so it's measured on different levels with different aspects. And in generally, the digital maturity is measured on companies or entities level, and there are reports and the tool how to assess that are already prepared, and it is the kind of a policy, especially in European Union. So it is something we need to be focused on, and because today we are talking about e-health, and I have started yesterday for the purpose of today's panel. And the report has been ordered by the eHealth Center in Poland in cooperation with Ministry of Health, and results of that. So the different aspects of this of digital maturity of entities who provide medical services have been measured in Poland, and in differs, and from several percent to 60%. So I guess that we are somewhere, and in average in eHealth on the level of individual entities, maybe on 30%. If 100 is our purpose. So as you said, it is the process. So at least having the tools for measurement, we can understand on which level we are at the moment and how far we are from our final goal and the purpose, the final purpose.
Thank you very much, ladies and gentlemen. This is the end of our panel discussion. Thanks for our speakers. Marzena Strok-Sadło, Lublin Medicine Medical and Wellness Cluster. Please, big applause. Professor Benedetta Giovanola, University of Macerata. Big applause. Professor Bart van Roomste, Leuven. Big applause, please. Professor Alessio Bertolecelli, University of Macerata, University of Modena and Reggio Emilia. Big applause. And Łukasz Gołąbek, Netrix Ventures, also big applause. Ladies and gentlemen, this is the time that I would like to invite everyone to the lunch break. We will meet again about 2:30 o'clock. Thank you very much. This is the time for Venture Lab presentation, products and services as an outcome of the project. We will have 10 minutes per topic, and as introduction, I would like to invite Gret Bilsen, Q11. Please, big applause.
Yes. Can I? How does it work? Okay. Sorry. Good afternoon, everyone. I would like to welcome you to hear the presentations from our Venture Lab sessions. Hannelore this morning already showed shortly where the Venture Lab fixed in the project. Let's see, our Venture Lab. Oh, that's something that something that goes wrong, but starting here. So someone went wrong, sorry. What was the Venture Lab actually? Actually, it was a hands-on exercise where we wanted to initiate the collaborations with the stakeholders, and this is a number of selected research lines. These research lines were selected together with the stakeholders during the discussions during the first phase. The different lines were presented this morning, and then we started our collaborations. And this was with support of the coaches. We have Mark and Nicolo present here, myself, and then also Giacomo and Dominique, who were not able to be present. We did not steer them. Okay, sometimes we had to steer them to give them some exercises to do, but actually the work came from them. They learned how to set up such collaborations, what to do, what can I offer to the external world from my point of view, from my research line. And this was all done actually in order to bridge between the research and the society, to make that bridge better. What's done at universities can be coded again. So they did a lot of things. They had questionnaires with the people. They had focus groups. They came up with presentations, with let's say courses, or at least training, curricula and so on. So they did a lot of things. You will hear about it now. And they also had to come up with an idea of a kind of startup. That means, what could I now bring as a service or product to the outer world? We will now have research line presentations. The work has been done by the researchers, and it's also up to them to give a short presentation. Like said already, they only have 10 minutes, so that means that they just can give the basics of what they did and what they can offer to the stakeholders or the external world. But then, of course, during the brokerage, during the networking session, you still have time to talk with them and to learn more about it. And then let's start with the first presentation. The presentation was called, in the research line, Training on e-health tools and patient-centered support for vulnerable populations. And this research line came from the group of social sciences, more specifically the health problems research, and it will be given by Mikhail Nowakowski and Andrej Juros. Come to the floor, it's up to you. I'm not going to give your presentation, but I'm going to time a bit.
I thought that I came too early. Hello, everybody. That was our research line, training on e-health tools and patient-centered support for vulnerable populations. And these are our research questions. We, as medical sociologists, when we started to think about e-health, we thought that it will be the best for our perspective to think about e-health and social inequalities, a term which we know and as a medical sociologist. And we thought that it would be very useful to think how e-health can influence the process related with social inequalities in a positive way or negative way. And we made two assumptions before creating our project. First was about more global context. I mean here some civilizational challenges like climate change, aging population, increasing migration, and technological progress, and what does it mean for local communities from the perspective of more vulnerable social groups, for example, people with disabilities, the elderly, poor, migrants, and so on. And the e-health is the design of the e-health, and its implementation is important in design and implementation of this kind of technologies to understand the needs of the barriers of people with special needs. So that was one thing. And second assumption was related with functioning of universities or researchers, most of researchers. And we thought that it would, too many of us don't attempt to present the results of the research as useful to business, government, and NGOs. And that's why we thought that maybe in creating our project could be useful to think that the solution may be the integration of three missions of university. I mean here, education, research, and cooperation with external partners on the micro level. Yeah, because I mean here, micro level. I mean the level of functioning of researchers as individuals or teams, because they can do that. So we've made something like that, our project will be involving three activities or missions of university: research, teaching, and social impact of university. I put it here, cooperation and co-creation. And we've made a research about e-health and digital literacy. It was related with older people because we know that older people has relatively lower digital competences than general population. And this new knowledge was used to do more things. Second was teaching activities. We created an elective course for sociology and social creativity students and public policy students. It was a course combined with social gerontology lectures, training, design workshops in which students are made to design workshops for older people, and realization of the workshops for this kind of people. And the last thing was something called Open Forum on Accessibility of e-health services and new technologies for persons with special needs, and that is an idea of Andrzej's idea, and he will say more about this. Thank you.
Some words about the idea of Open Forum. The Association Open Forum on Accessibility of e-health services and new technologies is not non-profit organization as a result which will be completed after the project. We want just now check the availability of this coexistence of inside partner, inside university, and this cooperation with stakeholders outside of university. We think about Open Forum as acting as a facilitator and platform for cooperation between these sectors, showing scientists and the university external environment the possibilities of valorizing knowledge, and forming consortia and obtain external funding. Our service or services is helping organizations to develop e-health solutions that are equally suitable for people with special needs. It's in some way connected with this legislation, which is connected with availability and these acts of United Nations. When we think about open forum on accessibility, we think that methodology ought to be based on the debate or deliberation between partners. From the perspective of people with special needs, it ought to be in this way, this central role of this group of persons. Debate as a starting point of universal design process, which will be implemented in the research process and also implementation process. Open forum will be and is transdisciplinary. It is next step to interdisciplinary because we start to build new level of knowledge about some processes which are not possible to complete on the level of interdisciplinary cooperation. Products and trisectoral, it means business, administration, and so-called civil society partners as participants of this process of cooperation and discussion on the level of open forum. Products, expertises, reports, studies, and it will be in partnership with other partners, which give us possibility for dissemination of these results, marketing and cooperation. And we have two lines of such a checking phase of open forum. We start our research process in cooperation with informatics, and it will be last presentation by Adam Kobus. We give such influence for these researchers that we stress the role of user experience perspective in building this process of researchers. And NGOs of people with special needs, in this case, we have organizations which are representing or member organizations of autistic group of people. And in this process, we don't have photos just now. It's not this presentation. And second phase of our open forum was connected with social life, which is main area of our sociologist researches. And here we made it from the e-health user perspective. And here are our two articles and reports. And in this, we use such signal stories which give seniors possibility to project their conscious process of perception of these new products which are now in e-health possible for using by them. And we cooperate in preparing this open forum with University of Third Age and senior sector of trade union, section of trade union. And in this, yes, okay. In this partnership, we cooperate with Lublin Consortium for Medicine in the beginning, and just now we are member of Lublin Partnership for Accessibility and Partnership for Accessibility on the national level. Here are these experiences which are not easy for a person with autism, and in this it is good cooperate with this group of persons and their families and their supporters, which prepare such a bridge between researchers and this autistic person. Here you have these instruments which are used. They are not just now for such a normal life of this group of persons. Open Forum goals is shaping the ability of think about AI that guarantees its availability, shaping the view of the purposes of AI, confronting users with what the researcher field looks like, analyzes challenges users, stakeholders see in the field of new technologies, the influence of users on undertaking new research directions. And in the last discussion platform, introducing as an introduction to the discussion regarding the directions of AI development. And why us? It's some kind of our propositions, and it's just now we plan to meet in the next months 2 open forums. One is some kind of evaluation of our researchers concerning autism diagnosis and rehabilitation, and second is connected with teaching processes in cooperation with seniors. Thank you.
And now we will hear about health-related communication. Dr. Ewelina Górka, Faculty of Political Science and Journalism, Institute of Social Communication and Media Sciences, UMCS. Introduction by Niccolò Testi, UniMC.
Okay, thank you very much. Good afternoon, everybody. And my name is Niccolò Testi. I'm from the University of Macerata in Italy. Together with Professor Giacomo Gistri, who couldn't be here today, unfortunately, we had the pleasure to coach 2 groups. The first group that I present today is that of Evelina and Magdalena on health-related communication, and I don't want to give many details on their research, otherwise I ruin the surprise. So please, Evelina, thank you.
Thank you very much. My presentation will be shorter, and I'm waiting for your questions, of course, after this session. So if you have any, yeah. Yeah, of course. So I'm open for the questions. Yeah, let's check if it works. Okay. So the idea of the Venture Lab presentation from my institute, Institute of Social Communication and Media Studies, is connected to the health communication. We would like to establish and develop, of course, a research team that will deal with 3 main tasks: conducting research, training activities, and production of multimedia content, of course, on topics focused on health communication. So we think about 3 main areas, which will be for us very interesting, and to give opportunity and a chance to meet other people, speak, talk, and give some information, for example, from our researchers. I'm sorry. The research team its short characteristics you can see on the screen, so I don't want to read all this information, but we would like to focus on researches and expertise from specialists who will work with us during that process. We of course think about partners, our colleagues from other university, and now I would like to thank you very much, Nicolo, and to Professor Gistri, because they are very patient person, and because we've got a lot of questions, and in my opinion, they give us a lot of very good responses that are for me very unique. So, because we prepare in our institute, for example, some media content, we would like to also offer some new possibilities in media production. Because we've got, for example, media studio, we have some materials. We've got, of course, space and special person who are well prepared how to create a media content. Okay, this is construction of a business model canvas. So I would like to say something about for whom this results will be interesting. So of course, individuals, entities involved in the creation of messages promoting e-health, companies, healthcare professionals, coaches, nutritionists, sports psychologists. I was thinking about all this information given to you, but I think it's not time for reading all this information. Expert knowledge, training, shared materials, opinions, instructions, media production. That's the main results. During the first session, I show you one of the examples. Media content, because this promotional movie, this promotional film, was made in cooperation with our two students from our institute. So we've got, of course, possibility to create films such like this. Okay, what about customer segments, for example? Individuals, entities involved in the creation of messages promoting e-health, companies, healthcare professionals, coaches, nutritionists, and key resources. I think I just showed you a couple slides ago. And channels, so direct contacts already established, promotional meetings, participation in fairs and industry events, participation in local events such as Seniors Day, Diabetes Day, sports events, participation in and activeness in social media. Yes, so our proposition, our idea is connected to our researches, is connected to the seminars, trainings, courses that we can organize, and connected, of course, to the health communication and digital communication. So if you want, if you have any additional questions, just like Gret said during my speech, I'm open for all questions. Thank you very much.
Thank you very much. And now, first aid in the digital era. Professor Katarzyna Marzenda-Młynarska, Dr. Justyna Kięczkowska, Faculty of Political Science and Journalism, Institute of International Relations, UMCS. Introduction by Nicolo Testi.
Hello, it's me again. And The second group that I coached is that of Katarzyna and Justina. I'm sorry if I don't even attempt to pronounce the surnames, but my Polish is not very good. Anyway, I don't want to ruin the surprise again, and so I ask Justina to come to the stage. Thank you.
Okay, good afternoon, everyone. Sorry, Kasia can't come because she has exercise in our department. I have short presentation for you about our, about our project. We start legal cooperation with our partner foundation, Mr. Sławomir Foundation, Primum Auxilium, and we start practice things. On June 15, there was a conference on our department, our institute, about health security. And there was a first training for students and for many our workers. And it was a very fantastic event for us. We planned workshop. There will be a briefing on cooperation between department and foundation and institutionalization of cooperation between UMCS and foundation. We have a legal agreement now. Our next steps are really difficult because we start to think about startup, integrated MedAid platform, and of course legal courses of first aid offered in national security, and workshops for seniors, especially for seniors which go for exercise on third aid university in UMCS. You can see here our long-term goals, and the most important of it, it's a startup. For me, it's a startup MedAid platform. But as you know, in Poland, it's really difficult because we have law, we have a problem with money, so now it's only a plan. Here you will see the main topic, main point of MedAid. We want to have a mobile app. We want to have online training for companies and communities. We want to have cooperation with alarm system operators and variable emergency devices. All of this point is, as I say, very difficult because we haven't got any relationship with big firms which made, for example, something like smartwatch or smart bands. And in Poland, our institute and foundation have problem with cooperation with alarm system and department as security department in our state. We want to show you value add, quick access to help with our products and service, education on the public. Education platform will help raise public awareness of first aid, which can help minimize the impact of accidents and medical emergency and of course technological innovation. Using modern technology, we will bring innovation to the field of first aid, which can change the way of response to emergencies. Startup, we have a dream that startup focuses of revolutionizing of the way people respond to emergencies as provide the first aid. And we want to do more workshops with Mr. Sławomir Foundation for our students. and pupils with schools which are cooperation with UMCS and with our department. And we want to have workshops for seniors from third state university in UMCS. That's all. Thank you very much.
Thank you very much. And now is the next subject, Autism, Dyslalia and Revalidation Classification Models. Dr. Adam Kobus, Faculty of Mathematics, Physics and Computer Science, Institute of Computer Science, UMCS. Introduction by Mark van Eycken, Q11.
Good afternoon. Ilona talked this morning about research meeting practice, and I think we've seen already some examples of that. And then we had this interesting debate on AI, and AI is fundamentally going to change a lot of things. And these two lines actually come together in the work that Adam has been doing. So very happy to introduce him and let him present what he's been working on, combining meeting practice and AI.
Good afternoon. Let's okay. Oh, here. Okay, only this. Okay. There are two research lines generally in this topic. One research line is connected to what Andrzej and Michał talked today. That there is a spectrum of autism and people with problems, with special needs. So I won't focus on that topic because this cooperation with BioMinds and with Michał and Andrzej is ongoing. You heard that, so it is an additional research line which will be developed later on. Second research line is what is strictly connected to the cooperation, my cooperation with industry and with Professor Van Romste, which when we maybe something more visible, there are problems that when the child come to the speech therapist, they come for half an hour just to focus on some phonemes, just to show what they could do, how they could learn how to speak properly. But it's just a short time during the week. And there's a lot of people that need this cooperation and need this help. And what we with industry created, we created a game which is which will help children to train after the meeting with speech therapists. They could train these phonemes, how to speak these phonemes properly, how to pronounce them. So one side is that there will be a speech therapy, and the second part, it will be a game, and from that game there will be information about there will be a children will speak the words, and we will use artificial intelligence to recognize if it's properly pronounced or not. It will be a game, so if the children will have a progress, even if it's not purely and properly pronounced word, but if there is a progress, the children will get some point and can build a world in that game. with this information will be also for the speech therapist. So if that children train with that game, speech therapists will get this information. If speech therapists use this application and get also the suggested maybe help with diagnose for the speech. So speech therapists will have information from the speech therapy, and also the report how machine learning methods see the problems for that child. That will be one thing. It will be a quite objective tool. Second thing that it will be easier for speech therapists to compare the results, so they can create a proper, better therapy for these children. So we came with that idea, and we developed this tool, but it was just in a draft, so it was not it is not yet prepared, but it is already ongoing. So we have a meeting with industry on October, and it is they did an off-road development, so they just do it after the work, and they prepared quite good game for that, and they need the analysis for the phone and for the demo, so they could show it for investors. So this is maybe so we will cooperate with industry, with Q11, so we can create proper automatic detection, recognition of badly pronounced words. At start, it will be a couple of phonemes. The problem is also with data. We talked about this, that each company need to collect their data, need to have Bioethical Commission confirmation, so they can collect this data, and it's hard to collect it. Also, you need to annotate this data, so it's a hard work and difficult to reach this data. But at the start, we have some data, so we can work on this, and hopefully it will be fully developed in not long time. So we prepared a budget plan for the startup with industry. So I hope we can reach some amount of money to prepare this, to collect this data at first, and then develop these machine learning tools so that we can properly diagnose, maybe not diagnose, help to diagnose these problems and create such game finally. Thank you.
Ladies and gentlemen, this is the moment for the closing speech and the questions. I would like to invite Mark van Eyken from Q11 once more.
Actually, I would like to get the researchers and the coaches back up here. So, come on, don't be shy. So now it's time for all the questions you might have, or remarks or concerns maybe, encouragement. So over to you, people from the audience. They've installed themselves, so they're there for... Okay, please go ahead. Is there a microphone we can?
You don't consider the public administration, public institution as potential clients for you, and I wonder why. For two topics, Michał, to you, and to Ewelina also.
Okay, who wants to go first?
When we think about working, okay. When we think about open forum, it's some kind of platform to discuss with whole spectrum of partners which create system of health system in Poland. When we think about financing system of health, it's created by public administration, and from this it is important partner. And just now, in the process of our researches and our cooperation, we had some difficulties in cooperation with Ministry, for example, of Health, because they don't want to open all data and some information. And it is, I think that such a debate on the open forum level, when we start to discuss in open such aspect, it gives possibility to find some resolutions for secure and person-centered system when we think about patients or these groups of people with special needs. It's important to have partners from public administration, from business, from NGOs. And it's my view of this.
Michał, would you like to continue? Because it's your topic.
Yeah, I don't know, maybe the Open Forum is a platform and facilitator of cooperation between university, inside the university, between various disciplines, because Andrzej and Adam started it, I think. The very important thing, which was idea of Andrzej's idea was to bring together end users and business and universities, and this is also from my perspective something new in our functioning as researchers. So your question was that we didn't involve it, but maybe it's a matter of our presentation. But
you think about it.
Yeah, yeah, of course.
Because if I'm regarding the new ventures and new companies or new products, so from my experience, everybody is thinking first of all having in mind commercialization. So first of all, public money are considered, because it is also considered, which is not true, of course, like easier money if it is according to the government or regional local policy. So you can get money for financing of your products.
Yes, but Adam said that we have some parallel when we think about therapy and games. When we think about therapy, diagnosis, rehabilitation therapy, we also think about self-organizations of patients when we think about third sector. And for example, when we think about transformation in Poland, the role of non-governmental organizations was crucial when we think about terminally ill person, hospices, and pain therapy, it was created, the system was created and influenced by non-governmental organizations. And I think that this cooperation is so-called partnerships of equal sectors.
Okay, thank you very much for that question. Maybe my presentation was too general, but of course we are thinking about, for example, sector you represent. When we think about our research team, when we think about our researchers, we think also about the trainings and, for example, preparing instructions, preparing some materials. So first of all, it depends on the needs. So if we will have, for example, information that topic like communication in public sphere about health will be interesting and will be, for example, in the future used for any other purposes, for us it will be big honor to prepare researches and, for example, add to these trainings or instructions that will be used in public sector administration, for example. Yes, so yes, we are thinking about cooperation, of course. We are very open, and thanks to this project, we know, for example, medical cluster and person represent this institution, Marzena Stroksadło. So for us, of course, this cooperation will be still in progress.
I guess it is a good idea for business and working with environment. And you, as a university, have many competitive advantages because this is public institution, so you have a trust. You can work with different stakeholders. So even developing your venture, you can create additional offers. For example, when working on production, on order of a client. So, for example, we can create the base of the actors, seniors, and yes, it's kind of capital for you, and you have such an opportunity. I can be the first actor, senior, playing for you for free.
Thank you.
If you accept me, of course.
Of course.
It is something our startups will make some productions, collect such proposals for the clients. It just one an idea, so, but it's good direction for both businesses to develop.
Okay, thank you. Any other remarks, questions? People from the audience. I should have brought my sunglasses with me when standing here.
So may I have? Okay. Speech training device, and I have a question to you, Adam. What about competitors and competitive solutions? Have you recognized this topic already?
Fortunately or unfortunately, there is. We 2 or 3 months ago, there was an article about this similar solution, about this such speech therapy. I sent it also to Mark and Reed. So I wasn't glad that they came with similar solution. They were very glad because it seems that there is a market for that. So it is I saw a different point of view for that. So there is a possibility to get this to the market and get a success. So it also we are concerned about AI because it's such solutions will come like mushrooms from every single point. So there will be a lot of such solutions which will help people and will be based on artificial intelligence. Because we have already very good tools for that, so it will be much faster to develop such tools. It will need to have data, right? So this will be still a problem, but how to develop these tools? It will be much simpler and faster, and the market would just grow. So this will be this is a concern that we have a small time that we can just get it and get go on this train. So we can just develop a lot of tools. Not only this, we talked about this tools about autism. With biominds, it is also which the remark which came. It need to I think said that I have this research about autism. We have EEG analysis in the lab, and for people with spectrum autism, but. On this open forum with Andrzej and Michał, we can try to, because it's hard to analyze this, hard to gain this data from this person, because it's not easy to collect data from people which it's invasive research for them. So it's for us. It's not the problem to wear such helmet, but for them it's a very big problem, especially for children. So we will try on this forum. We will try to develop such way that it will be a good solution for create our research, and after that do a, for example, screening. So if we involve the remarks from people which they need, with special needs, and we can develop tools to create such research and such examination, so that they won't be they won't be bothered, but they won't be invaded by this examination. It will be a great tool, and it could help many people. And it won't be only for research, and that's it could be done or something like that. It will be a tool that could be done and could be used in the screening generally for people.
Thank you.
Okay, I think we have time for one more question.
Only about first aid, because you will meet very strong competition from the public sector, because all emergencies and medical university and many public organizations offer the trainings in first aid. So what do you think about it? So
yes, we have problem with cooperation. You talked about administration. We try to have cooperation with Ministry of Health, but they gave us a very negative answer, because they think about us as a concurrence. The most important thing for foundation and for our departments, it's a workshop for students, not only one for a year. But for example, one a month. Yes, we have a lot of proposition in the public administration, in the university, but we have problem with using it. Foundation is very near students, very near people, and we want to do it. So we are not a concurrence, but we want to try to do big thing. Mr. Sławomir think about Center of First Aid, but he has problem with money, of course. It's important. He tried to have cooperation with city, with Ministry of Health, but as you know, answer was bad for him too. So we try, and for us it's enough for our students and for senior, for example.
Okay, and then we have one final question in the back.
All right, so I try to be very brief. I have two questions also for the last presentation. At the end of it, you said that you are aiming to collect 200,000 euros, and I wonder if you have already applied for any external funds to realize your project. And the second question is, I wonder if you consider applying the same tools to solutions in different languages, because I believe this one is addressed to the Polish language, and that perhaps might open you to the new markets if this is something that you are aiming to. Thank you.
Well, I'll start from the second one. It's easier. Yes, it's the solution we create. It's easy to apply in different languages. So, of course, there will be different problems, right? We need to collect this data for these different languages. There are more or less problems in these languages with speech disturbances with pronunciation. So we'll need to apply this. We need to collect this data. But the whole solution is the same. We just need to train the model. The model will be the construction of the model will be similar, because if it's working for one problem with pronunciation, probably we can use it in multiple phonemes, for multiple problems. So we already in Polish have a lot of pronunciation problems. So we will need to develop a lot of. We will have problems with multiple phonemes, and we'll create multiple tools for each problems. For example, for stuttering, for prolongations, etc. So this is one thing. There will be internalization. It's already developed in that way. Second thing about the fundings, we need to have a demo for that. So we need to have a solution that it's working already. So we will see that we can do this in quite good way. So investors could see that it will be it could be done. So I hope until the end of the year we'll create such demo, and we can just next year we'll be trying to get some funds from investors.
Okay, thank you. When we started this venture lab, I still remember, it's not that long ago, we had these discussions about, how can you connect to the outside world, how can you come up with ideas, how can you valorize what you're a researcher. And the only thing we got back then were, blanks, staring at us saying, we have no idea. Remember that? And then now we've come a long way in actually a pretty short period of time. So please, during the brokerage event, talk to them, talk to the researchers who are now also going into venturing, which is really great to see. So talk to them, come up with new ideas, with suggestions, with positive criticism, anything you can do to help. Also, there's posters downstairs, so there's other researchers there. Go talk to them, go connect, and use this event to improve on the ideas, to encourage. There were a couple of questions about competition. One of the fundamental rules in business is that if there's no competition, you're probably doing the wrong thing. Competition is actually a good sign. It means that there is probably a market, there is probably people interested in it. So if you're looking for the area which there is no competition in, you're probably wrong. So I think the questions prove that you're actually absolutely right, and it's about finding the right way to go to that market. So with that, I want to like to ask you for a big hand for the team out there who've done a great job.
Thank you very much. Thank you very much. And this is the best time for the brokerage event. Everyone will have 15 minutes to presentation, and the first one gonna be Bona notitia, excuse me, Marcin Stachyra. I would like to invite Marcin. Here you go, this is your time.
Okay, good afternoon. All right. We have 3 minutes left, but I used my time for asking some questions, so I think I'll be within 10 minutes. I should tell all you should know about our foundation. Bona Notitia Foundation. Bona Notitia is a Latin term for good news. First of all, naming our foundation that way means that we wanted to come up with some positive message, and I hope, I believe that we are managed to do so. I'll start from introducing ourselves. First of all, we are a non-governmental organization, the foundation, as you've already heard. We are also the social economy entity, which means that among our goals, there are ones which are addressed to help or to solve somehow certain social challenges. And we are trying to achieve it by some of our activities, about which I'll try to talk later. We are a relatively new entity. We have been established, in fact, not in 2020, but a year before, but proper activities started in 2020. Our headquarters are located in the northeast of Poland, which is Voivodship Warmińsko-Mazurskie, in a tiny village called Kraskowo. Nobody of you probably never heard about it. And I never been there, to tell the truth, because I operate in the Lublin area, where is our second location, and the main activities are being held. What we do, once we were launched, we were thinking from the very beginning about two key areas of our activity. First one was the support for the local media, and this is because of our origins. The foundation was founded by Grupa Tip Media, which is a company from Lublin, which offers solutions, a variety of IT solutions for local media outlets across Poland. There are, I think, nearly 200 of local media that use our CMS, which is content management systems. Basically, this is a tool that helps them to create their websites, to attract the advertisement, and also to engage their communities around local issues. So because of that, because we have certain reach for the local media, we thought that why couldn't we help them somehow to be more efficient, to be better? And what we do is, on one hand, providing them with some training, advisory, or consulting services, and on the other hand, we also give them a chance to use CMS and also to other non-governmental organizations we created along with our partners, Grupa Tip Media, dedicated CMS tool, which is called For Community Online. Apart from that, we wanted to extend our business-oriented background and offer the same kind of training services to small and medium enterprises in Poland. That's why we are a certified provider of such services, which is registered at Development Services Database. In Polish, this abbreviation is known as BUR, Baza Usług Rozwojowych. And for past 2.5 years, we've been able to provide a number of such trainings for small and medium enterprises in Poland. Another project of ours is dedicated to the companies which think seriously about going abroad. Hence my question for the previous presentation about thinking about international markets and going abroad. We also help that. We have partners abroad, especially in the United Kingdom, and our project dedicated to entrepreneurs that want to go abroad, specifically to the UK, might be of their interest. Our partners are key to, I would like to say, success. We have some successes, but it's not me to judge this. But our partners are certainly key to be able to speak about certain activities. Institute of Communication and Media Studies of University of Maria Curie-Skłodowska in Lublin is one of our key partners. The World Association of Polish Language Media is also an important organization that we have been cooperating throughout the years. Another one, and this is a very long name and I never can remember it properly, it's Polish Association of Local and Regional TV Broadcasters. Grupa Tip Media I mentioned before, and C4DI, this is the Center for Digital Innovations. It's an incubator located in Northern England in Hull. And we have been running certain programs with them. So a bit of our projects, they vary from those addressed to local media and specifically to the Polish language media worldwide. We have been co-working with them by organizing 3 events between 2020 and 2022. Important project that I think comes across the main topic of REINITIALISE, which is Accessibility Plus. We have been one of the benefactors that couple of years ago run a social campaign for accessibility along with the Association of Polish Local TV Broadcasters and Truso Media. We created a series of webinars dedicated to this issue and also created a film that probably you can watch on YouTube. And it was a story about a former hockey player, an Olympic winner hockey player of Paralympics, and his way to success in this field. And he also talks a lot about his everyday life, how it looks from the perspective of a person with special needs. Other projects relate to those Pathway to Selling in the UK project, which means that we help companies to build a strong network in the United Kingdom. And also one of our key business activities at the very beginning were connected with filmmaking. Most of all, it was subtitling for video materials. This was caused because of changes in Polish law, which required public entities, public sector, to provide all the film materials with subtitles for people with special needs. And that's what we do along with our partners. Don't mention, I think I didn't mention them, it's Autoscribe, it's another company that works with us on that. Also, News for Media is our side project. We created a packages of news for local media that were too small to create their own newsroom and to provide news by their own, so they could use our package to create something on that basis. And of course, during the years, we run over 1,000 hours of trainings, consulting projects addressed to mostly managerial issues. The Academia Managerial Academy, it was one of the projects within the base of development services. And a number of companies around Poland were the benefactors of that. So if you think there is some crossing path between us and your activities, please feel free to connect with us. We are present at LinkedIn. We have our website. Unfortunately, so far it's only in Polish language, but we are aiming to change that. We are aiming to change that because recently we have been informed that we are going to be granted with certain money to extend our activities by building online platform through which we'll be offering a certain number of trainings for different types of people, including those with special needs. That's one of our aims. So our website will be changed accordingly as well. So thank you. Probably the questions will be at the end. Okay, thank you so much.
Thank you so much, and this is the time for Ilona Dąbrowska from Międzynarodowy Instytut Edukacji Medialnej. Ilona Dąbrowska, I'd like to invite you so much. I hope Ilona... Online, okay, so Ilona is online with us. We are waiting for connection.
Yes, I'm here.
Great.
Can you hear me?
Yeah, we can hear you. You can start.
I hope you will. Yeah, I hope you will see me soon as well. However, we didn't make any try, so okay, a few more minutes. Okay. So you can hear me, but you cannot see me.
That's right.
Right? Okay. So a few more seconds, maybe. Has something changed? No? Yes?
No.
No. My presentation is on and my camera is on and I had no idea what's going on. So a few more sec. Okay. Now. Maybe now it will be all right.
We have the
One
black
more
screen
second.
right now.
Yeah. I think it should be, yeah.
Yeah.
You got me. Yeah, and
We
I
can
can see
see
myself as well. Okay. So now let me just try to put on the presentation. Can you see my slides right now?
No, we can see only you.
What about now?
Still no.
Still nothing. Oh gosh. It's because I'm not used to work at Zoom. But just a few more seconds. I'm so sorry. I'm wasting my time. I know it's a precious, but where is it? Where is it? Where is it? Okay, it should be. Oh gosh, where is the? Okay. Where is this screen? Can anybody help me with that one? Where is the button to show my screen? Because I cannot see it. Yeah, got it. And now it should be all right. Finally, right?
Yeah, it's almost full success.
Yeah, almost.
Almost,
I know.
yeah.
I can see.
Full screen and
Yeah,
voila.
we got it?
Yeah.
Well, I'm so sorry for that.
No problem, we can start right now.
Thank you very much. So really glad to hear Marcin before me and also hear the discussion for the whole day. I'm really sorry I cannot be today with you, but unfortunately there is an unpleasant guest right now at my house, which is called COVID, but I hope he will be leaving soon. But for today, I will try to present the foundation that I established in 2022. So we are even more fresh than the one before. The foundation and the idea of the foundation was born in my head, and it was the result of the observation of what's going on in the world right now. So, for example, we noticed, and I've noticed, that there is a huge need of education in the field of new technologies. I think that today's society is like we are all really fed and we are surrounded by technologies, and which sometimes we are even forced to use technologies to talk or to look for informations. But at the same time, we had a huge problem with education, with media education. And it's like, of course, the non-governmental organizations are doing that, but I feel like there is a big gap that we can do something with. So the idea of the foundation was to educate, but also to connect and to make an improvement in the field of new technologies and communications. For those 2 years, not full for 2 years, but for almost 2 years, we did some things that I would like to talk about. For example, we are training. We are training about media, and we're doing media education, and it's conducted at school and also at academic levels. But also what is very important to us is to start teaching pupils and children which are at primary schools. For example, we know how new technologies are present in those lives, in their lives, but without educating how to use it safely, they may appear at problems. So that's one of the goals. The second goal is to promote opportunities and threats related to new technologies at the local, also local media, local radio station and website as well, and also publishing books and films educating about new technologies and, for example, social media. So now a few more details. In 2022, we published a book, and the book was titled The Patient Zero. So it was about the very first patient that was ill on COVID. But the thing is, it was not about him, but it was about the hate speech that appeared in the internet while he was ill. So a very huge issue, a very big problem that we discuss in that book. I'm so sorry because I was meant to take those books with me today, but it happened. So I hope maybe in the future we will meet again with the books. What we do also is our regular radio broadcasts on Polish Radio Lublin. So for example, if you will have some spare time tomorrow at noon, you can hear me in the Polish Radio Lublin, and I will speak tomorrow about deepfakes. So it's a very, very fresh thing, not very fresh thing when we think about decades, but very fresh thing if we speak about what's going on right now, for example, in a Polish politician, with Polish politician. What else? Classes with the young people as a part of information education in the fight of the hate speech, social media and communication. As I said before, we do those classes also with very, very young kids. And also we're thinking about educating seniors, educating older people, for we also notice there is a big problem with this inclusion, exclusion and inclusion. However, there are still some other training programs, but still we notice there is a gap, and we would like to fill it. International cooperation, working on reportage and short films that are culminating with a film gala. We are showing a lot of educational films, a lot of reporters about new technologies, about media, what this can do with our lives. And finally, the international cooperations. So that includes lectures and trainings in the, for example, European Parliament. In a few weeks, I will be in Brussels in the East Poland House, and I will be speaking about deepfakes during the Russian invasion at Ukraine. So we are trying to be present also at the international level in the other countries, but at first we work here in Lublin. And just to let you know that we are trying to be present also at the most important events that are running in our field. For example, Polish language festival that are always every year in summer in our region, and then a lot of congress that are taking place in a different part of our country. We are really doing everything to be present, to follow the absolute must-know issues and to be on time. The other thing that we are doing is cooperation with the Polish Press Agency as a part of the Counter program. There is a great program running by a Polish presidency. It's called Fake Hunter, and we are helping them finding fake news in the internet, especially deepfakes. For example, if somebody would be more interested about what deepfake is and how those technologies works, I would like to just play it, but it can be played in the back, and while I'm still talking. This is the thing which concerned me very much those days. The deepfake technology that is now used, and it's used to be used right now during the war. So the deepfake technology, we knew it from 2018, 19. That was the moment when it shows up. But for today, deepfake technology really developed, and it's getting better and better with every single week, every month. So the really basic right now is to educate people, to make them know that there is something like deepfake and how does it work and what this can really do. What is the issue? What is the real problem? What it may cost? And the second one, the second movie that I got here, a very great one, but I'm afraid you won't hear the voice. So can you hear the voice? I just put it on. No? Yes?
I think yes, we can hear it.
Yeah, okay. So I will try to play it, okay? It's just few seconds, but I really think it's worth it.
AI is far more dangerous.
Hey, Mom. Hey, Dad. It's me, Ella. Well, a digital version of me, just a bit older. Amazing what technology can do these days, isn't it? All you need are a couple of pictures, like the ones you share on social media, where they can be taken and used by everybody. I know for you, these pictures are just memories, but for others, they are data. And for me, maybe the beginning of a horrible future. A future where my identity can be stolen just like that, where I can go to prison for things that I would never do. Imagine my credit score being destroyed, Dad. Or my voice copied to scam you, Mom. I'm in trouble. I need you to send me money. I don't want to become a meme, humiliated by everyone at school.
Kill yourself, you fucking loser.
And I certainly want this. What you share online is like a digital footprint that will follow me around for the rest of my life. I'm telling you this because I know you love me and would never do anything to harm you. So please, Mom, please, Dad, protect my virtual privacy.
And just to stop, just to finish, with that thought, with that big issue, I also would like to invite you for the cooperation. Maybe someone would just have a green light in his head right now saying that, yes, we can cooperate together. So you're invited. Please, you can send me an email or just find us in the web, and hope to stay in touch. Thank you very much.
Thank you very much. That was Ilona Dąbrowska. And this is the time for Gazela Sadurska from G-Rake. Please welcome her with a big applause.
Hello, everyone. Thank you for inviting me. The presentation is written by English, but I will tell it in Polish if the English-speaking guest allow me. But no, it's not my presentation. My name is Gazela Sadurska, and I'm founder of G-Rake startup, which is solution answered the TechNec. And TechNec is a growing problem about our time. How about my presentation? don't know. Jest jeszcze, tak?
Tak, bo jest jeszcze pani Anna Błaszczak.
Okej, dobra.
Okay, if I may, we can change right now the presentation. We will wait for Jurek and Gazela Sadurska presentation, but now I would like to hear Anna Błaszczak. Anna, I hope you are here with us. Please welcome Światowe Centrum Słuchu Instytutu Fizjologii i Patologii Słuchu. Please welcome Anna Błaszczak.
Okay, thank you. I will try. Okay, hello everyone. My name is Anna Błaszczak and I represent the World Hearing Center of Institute of Physiology and Pathology of Hearing. Our institute is located in Poland, in Kajetane, near Warsaw. I would like to thank the organizers, especially Dr. Ewelina Górka, for inviting my team to this conference. And I'm pleased to present you our device, sensory examination capsule. Okay. So, the capsule is the first in the world innovative screening and diagnostic system, which provides complex, fast, easy to perform diagnostic tests for the most important human senses. Professor Henryk Skarżyński, the director of our institute and also the originator of the capsule, desired to create an easy-to-use standalone device that could provide a series of simple screening tests for 5 senses. Hearing, sight, smell, taste, and balance. Due to extended waiting period for similar examinations at medical centers and necessity to visit few of them, the capsule can become a unique device which enabled fast and easy sense examination, all in one place, all in our capsule. Moreover, the capsule popularizes and facilitates access to screening examinations. And all these feathers are very important, especially in our era, in era of civilization disease threats. So, the project was implemented by a consortium of research units with unique competences in the field of otolaryngology, audiology, and phoniatry, as well as biomedical and material engineering and telemedicine, with our institute as a leader. This project was developed and carried out by many research facilities from all over our country, from Center of Hearing and Speech, Medinkus, from Medical University of Warsaw, Warsaw University of Technology, Collegium Medicum of Nicolas Copernicus University, and co-founded by the National Center of Research and Development. So, who can use the device? The capsule was designed for people older than 7 years old with reading skills. The capsule provides an optimal acoustic and lighting environment and also is adapted to the needs of people with reduced mobility. The restrictions are claustrophobia because of size, our capsule, and photosensitive epilepsy. It's important when we are examine balance. There is always a capsule keeper, supervisor, for our capsule. We have 5 capsules in our country, so every capsule has your own capsule keeper supervisor. In order to help you understand it better, I can describe the capsule as a small room. A small room which our patient enters by himself and he can check his senses without any assistance. Because the capsule guides the patient through all steps of testing. Chair. Okay, so first of all, before the examination, every patient has to sign into a dedicated patient portal. After that, an individual ID, PIN, and QR code are generated. These are necessary to log into the capsule examination application and also grants access to examination results after their analysis by physicians. So an active email address is essential for the registration. Patient enters the capsule. He scans his individual QR code, or he enters his ID and starts the examination. The tests which are available in the capsule are used for screening diagnosis of the senses. So not only they are professional, but also they have user-friendly graphical interface, so that there is no need to have any specialized knowledge to use it. The interface is also visually attractive and intuitive. After the patient logs in, he can choose one of the tests. Yeah, hearing tests, smell, taste. Each test contains an instruction presented on the screen, an audio instruction, and, if it needed, a short video instruction to maximize the comfort and simplify testing procedures. Thanks to all these facilities, patient does not need a specialist assistance. And first test is a hearing test. We examine the ear as a hearing organ. Basic hearing examination is a pure tone audiometry. Our patient puts on headphones which deliver quiet sounds of various frequency. And if patient hears the sound, he clicks on the button I hear. Our experience show that small kids distract themselves easily. So in order to meet the expectations of our youngest patients, we have created the kids version of a pure tone audiometry, which is enriched with animal graphics. The second part of hearing test is an examination towards central auditory processing disorder. During a series of 9 subtests, the brain's ability of sound interpretation is checked. Second test is sight test. Is split into 4 parts. Near vision tests is about to interact with the symbols presented on the screen using computer mouse. Contrast recognition test is about to specify the moment of recognition of the grayscale strips on the screen. Distance vision test is similar to the first part, to the near vision test, but in order to obtain a proper distance within our small room, our small capsule, we use mirrors. And the last is color recognition test, and it is about to create a fluent color gradation from a group of colorful squares. Third, smell examination. Inside the capsule, our patient finds this very envelope. And the essence of smell test is a recognition of the specially prepared test strips. And I will... It's something like that. It's our test, and it is covered with a special substance which emits aroma after rubbing it. And patient needs to match the aroma stripe to one of the pictures on the screen. The next test is taste examination. After our patient clicks on the button taste examination, one of the shelf inside the capsule highlights, and patient opens it, takes the envelope which is hidden inside, opens the envelope, and takes out samples and starts the examination. Yeah, this is our strips. And the essence of the smell test is to recognize specially prepared test strips moistened with a special solution which emit flavor after putting it inside our mouth. Yeah? Sure. He needs to match the flavor to one of the pictures on the screen. The last sense is balance. The first part is to examine the eyeball movements stimulated by the symbols and the graphics on the screen. The movements are recorded by special Google rig with camera capturing these movements. And in the second part, the user has to stand still on the special mat without any movement, with opened and with closed eyes. And feet pressure distribution is measured. Based on the examination results, a specialist is able to state if there is a dysfunction of balance or not. The capsule is also a meeting place with specialists. All examination results are available to the specialists on the online platform called Doctors Portal. If the examination results are not auspicious, a specialist can invite the patient in order to consult the results and suggest further diagnostic. Currently, there are 5 stationary capsules and 1 mobile capsule, which is used during differential educational and research events. Moreover, one of the stationary capsules is placed in Lublin, in Ecotech Complex, to which I invite you all. You will be able to see the capsule yourself and perform all examinations on your own. If you are interested, I invite you to have a conversation or to mail us. kapsuła.lublin@ifps.org.pl. And thank you for your attention.
Thank you very much. If you have any question, it's going to be a time for asking the question. I hope we are ready right now for Gazela Sadurska, G-Rake. Please big applause one more time.
Now it's my presentation. So hello everyone once again. My name is Gazela Sadurska and I present G-Rake. I tak jak właśnie wspomniałam wcześniej, powiem to po polsku, bo będzie mi trochę łatwiej. G-Rake zauważył problem, który rośnie i rośnie wraz z digitalizacją naszego społeczeństwa i generalnie z rewolucją cyfrową, czyli problem z odcinkiem szyjnym kręgosłupa. Bo nikt nie zastanawia się tak naprawdę, co dzieje się z naszym ciałem, podczas kiedy my pracujemy, gramy, komunikujemy się z naszymi przyjaciółmi, czy po prostu scrollujemy, bo raczej wszystkim się w tych czasach zdarza. No i przepraszam. I tak, 26 milionów smartfonów w Polsce, to tylko rynek polski. Wszyscy wiemy, że coraz młodsze osoby coraz wcześniej sięgają po urządzenia mobilne. No i niestety z badań wynika, że ponad 40% osób już z epizodem bólowym nic z tym nie robi. Ale G-Rake chce zwrócić uwagę na to, że ten problem nie zniknie, będzie się rozwijał i my chcemy mu przeciwdziałać i przede wszystkim uczyć profilaktyki. I teraz tak, żeby to bardziej zobrazować, wyobraźcie sobie Państwo walizkę, taką, którą nadajecie do bagażu. To jest około 27 do 30 kg i tyle nasz kark dźwiga, kiedy już skrajnie w złej pozycji spędzamy czas nad ekranem. Co to jest w ogóle technek? Technek to już stwierdzona cywilizacyjna choroba XXI wieku, która nie tylko dotyczy bólu bezpośrednio karku czy szyi, ale innych dolegliwości, takich jak przewlekłe migreny, niedotlenienie, problemy z koncentracją, problemy ze snem, czy nawet drętwienie rąk i barków. I tutaj szybciutka prezentacja, która w minutę pokaże cały koncept. I zanim przejdę do tego, do kogo kierujemy to rozwiązanie, bo mogło wydawać by się, że do wszystkich, to chciałabym też podkreślić, że technek to przede wszystkim niepoprawna postawa i nie ma na to cudownego rozwiązania poza budowaniem pozytywnych nawyków i podnoszeniem naszej świadomości na nasze ciało i świadomości konsekwencji zdrowotnych, jaką niesie za sobą rozwój cyfrowy. I w pierwszej kolejności dedykujemy to rozwiązanie dla osób pracujących z urządzeniami mobilnymi. Ja ich nazywam hard users. Są to nie tylko osoby pracujące umysłowo, ale również cała branża kreatywna, oczywiście cała branża IT, no ale również Państwa jako naukowców na pewno to dotyczy, bo podejrzewam, że pisanie prac naukowych i robienie badań to żmudna praca właśnie przed komputerem. Oczywiście pandemia i cała transformacja pracy i warunków pracy oraz przeniesienie się z pracą do domu mi poszerza rynek. Państwu niestety psuje zdrowie. Także tutaj widzimy też duży potencjał do tego, żeby pomóc pracownikom w pracy zdalnej. No i oczywiście, tak jak wcześniej wspomniałam, coraz młodsze osoby sięgają po ekrany. My tego też tak bardzo, wydaje mi się, że nie rozumiemy, bo nie żyjemy tak naprawdę w półcyfrowym świecie. Nie gramy, nie tiktokujemy tak dużo jak młodsze pokolenie, więc stąd też moja prognoza na to, że rynek będzie rósł. No i dobrze jest dzieci uczyć wcześniej dobrych nawyków i zwracania uwagi na tą higienę cyfrową, zanim tak naprawdę one nabawią się już dolegliwości, które trzeba leczyć u ortopedy, czy w mniej tragicznym wypadku u fizjoterapeuty. Żeby skalować to rozwiązanie, chcemy je sprzedawać jako benefity dla firm. Teraz działy HR i employer brandingowe prześcigają się w wymyślaniu fajniejszych, ciekawszych benefitów dla swoich pracowników. Myślę, że nasze rozwiązanie, poza tym, że ma dbać o ich well-being i zmniejszyć ich zwolnienia lekarskie, liczbę zwolnień lekarskich i generalnie poprawić ich jakość życia w pracy, ma też w planach taką grywalizowaną platformę specjalnie właśnie pod produkt biznesowy, żeby wzmacniać relacje w zespole, bo z tym też mierzą się zespoły HR-owe w naszych czasach. No i taką pośrednią moją grupą są fizjoterapeuci, którą chciałabym zaangażować do sprzedawania tego rozwiązania, gdyż nasze rozwiązanie absolutnie nie jest konkurencją dla terapii fizjoterapeutycznych i dla fizjoterapeutów. Raczej ma być to monitoring postępów ich pacjentów bądź braku postępu, urządzenie wspierające terapię. Fizjoterapeuta ma dostęp do raportu z nawykami pacjenta, a aplikacja ma w sobie ćwiczenia, więc terapeuta też może sprawdzić, czy jego pacjent oszukuje, czy ćwiczy zgodnie z zaleceniami. I o samym rozwiązaniu. G-Rake to bardzo małe urządzenie, które naklejamy na kark. Za pomocą wibracji daje użytkownikowi znać o tym, żeby poprawił swoją postawę, kiedy wykryje odchylenie od normy. I urządzenie łączy się z aplikacją, na którą przesyła w czasie rzeczywistym dane z urządzenia na temat naszych nawyków oraz proponuje użytkownikom bardzo krótkie ćwiczenia wzmacniające ciało, ćwiczenia relaksacyjne i krótkie instruktaże z automasażem, tak żeby cały produkt i cały system uczył nas zdrowych nawyków i naszym takim celem marki jest to, aby pokazać ludziom, że małe kroki robią duże efekty, jeśli chodzi o nawyki i tak naprawdę wszystkie książki na temat nawyków wspierają tą ideę, żeby codziennie troszeczkę coś poprawić w swoim życiu i zrobić coś dla siebie dobrego. Nie muszą to być wielkie działania. To takie dane techniczne, bo stwierdziłam, że jak jesteśmy na uczelni, to może kogoś to zainteresować. Urządzenie jest przebadane, przeszło szereg testów, jest bezpieczne. Mogą go używać raczej wszystkie osoby. Urządzenie, tak jak wspomniałam, łączy się z aplikacją. Urządzenie i aplikacja są już dostępne do kupienia na rynku. Jest to urządzenie, które działa i aplikacja jest też dostępna w sklepie za darmo. Wtedy możecie Państwo skorzystać z naszych ćwiczeń, zanim kupicie urządzenie i zapoznać się z nami. Dlaczego żyrafa? No, żyrafa jest czymś, co kojarzy nam się z szyją i moja problematyczna nazwa startupu to tak trochę teraz wymyśliłam historię, że jest to taki żyrafi ból, czyli jednak ból szyi, więc my chcemy zwrócić na niego przede wszystkim uwagę i dzięki tej autoobserwacji i wprowadzaniu dobrych nawyków długofalowo osiągać efekty i cieszyć się zdrowiem. Urządzenie jest dostępne w cenie 699 zł. Przy zakupie urządzenia otwiera nam się opcja na G-Rap Pro, czyli szersze funkcjonalności w aplikacji. Produkt dla biznesu i produkt dla fizjoterapeutów są jeszcze w fazie projektowania, ale są to nasze dalsze kanały sprzedaży. No i tak jak wspomniałam, właśnie małe kroki robią wielkie efekty i uważam, że jeżeli nam się nie chce, to każda wymówka jest dobra, a jeśli nam się chce i jakby mamy potrzebę, no to znajdziemy sposób, aby zrealizować nasze cele. Także G-Rake ma pomóc w tym, aby realizować cele, ale nie używać do tego dużo wysiłku, bo myślę, że i tak jesteśmy przeciążeni i przestymulowani obowiązkami i wiecznym rozwojem. No i jest, za Jirejkiem oczywiście stoją ludzie, nie tylko ja. Jest to zespół głównie z Lublina. Ja wraz z moimi wspólnikami, Kasia jest osobą zajmującą się finansami, Marek to fizjoterapeuta, który ułożył cały system ćwiczeń w aplikacji, a ja jestem szalonym naukowcem, który nigdy nie przeszedł przez uczelnię, tylko trafił na ścieżkę startupów. I co chcemy w przyszłości zrobić? Teraz urządzenie testujemy, zakończyliśmy projekt, który finansował naszą działalność przez 2 ostatnie lata, dzięki czemu powstał pierwszy produkt, który teraz możemy sprawdzić z rynkiem, wyjść do naszych realnych użytkowników. I wychodzimy z marką na rynek. Chcielibyśmy rozwijać się w zakresie właśnie analizy danych, ponieważ dzięki temu urządzeniu bardzo dużo danych zbieramy i widzimy tutaj duży potencjał zarówno do badań, jak i rozwoju produktu. I chcielibyśmy w przyszłości skierować ten produkt również do kolejnego kanału odbiorców, jakim są dzieci, bo wydaje mi się, że dzieci są bardzo mocno zostawione same sobie w takim kontakcie z elektroniką i zależałoby mi na tym, żeby ta marka też zwróciła uwagę na to, że bardzo ważne jest pokazywanie dobrego przykładu dzieciom, jak pracować bezpiecznie z elektroniką, jak korzystać z jej możliwości, jak przede wszystkim dbać w tym zakresie o swoje zdrowie, bo wszyscy wiemy, w jakim kierunku to idzie. Także dziękuję bardzo. Jeśli chciałby ktoś porozmawiać, to zapraszam.
Thank you very much. Is it me or you two sat straight during this presentation? I hope you too. Ladies and gentlemen, this is the moment for networking, and this is the time for asking a question, but not here. Let's go to the foyer, let's talk face to face, and if you have any question, please, let's do it. And this is also the end of our main event here. We will continue in the foyer. So thank you very much for being here, and thank you very much, and have a good night, good evening, and good day. Thank you.